East African community, let's sing the 3 national anthems. We shall begin from home in Uganda, and then we come to Busoga, and then we go to East Africa. Yesterday I learned that the East African one, rather the East African one is not on the other system. I hope they got it. If they haven't, we are going to sing it. We begin with the Ugandan national anthem. And we used to sing it when we are standing stiff and alert. Can we exercise that? And we... Okay, 2, 3, we go. East Africa. Somebody pray for us.
Let us humble ourselves and pray. Lord God, our Father, we thank you for counting us worthy to be here in this health assembly for the purpose of enhancing life. Lord God, we thank you for all stakeholders in the health sector. We thank you for the ministry. We thank you for the local leaders, the cultural leaders. We ask you, God, to go before us in all we do, all we say, all we think, so that every word of ours here, every work of ours may be begun by the Lord, and by the Lord may be happily ended through Christ our Lord.
Amen. Ladies and gentlemen, I want to request you to sit comfortably. My name is Milton Mwisaka. I will be working under my colleague who is walking ahead of you and knows how to pronounce these names better. And so, this, which began yesterday, is getting to its climax today. And we are going to do everything we do very fast because time is fast spent. And so we would want the convener of this assembly to march over here and have the words that he has prepared to talk to us and to the minister. Welcome, and usually we do welcome people with a hand clap as they walk up here to speak good words to us. Thank you so much, Director. You're very welcome.
The Honorable Minister of State for Health, General Duties, Honorable Anifa Kaoya Bangirana, together with your entourage from Ministry of Health, the resident city commissioner, and all the dignitaries here present. It's my honor now to, first of all, Honorable Minister, inform you of the stakeholders that are here by recognizing them in the different groups I'm going to mention. And then thereafter, I'll tell you about an overview and objectives of Busoga Regional Health Assembly that we are having this time. Honorable Minister, in here, we have honorable members of parliament from Busoga region. We invited from each district a honorable member. I want to believe some honorable members of parliament are here. I can see you can stand up and wave. Thank you so much for coming to bless this occasion. We have the resident city commissioner seated close to you, and all the resident city commissioner, resident district commissioners, RDCs. Could you all stand and be recognized? Thank you so much for coming. We have the Honorable City Mayor of Jinja City. Honorable City Mayor or a representative. And all the, yes, behind there, we have the City Mayor and all the LC5 chairpersons of all the districts in the Busoga. All the district chairpersons, can you stand and wave to the Honorable Minister? Thank you, chairpersons, for making it to this occasion. We have the chief administrative officers across Busoga, the city clerk and all the cows. Can you stand and wave? Thank you, chief administrative officers, for making it here. We have secretaries for social services across Busoga, 12 of them. Yes, I can see. Please wave to the team. Thank you for coming. We have Ministry of Health representatives, led by Commissioner Dr. Sarah Biachika. Yes, all the Ministry of Health team, please stand. We invited different commissioners from clinical services, surveillance, infrastructure, and planning, and then also Dr. Isa Makumbi is here. Thank you so much, Ministry of Health team. We have the chairperson and members of Jinja Hospital Management Board. The board members, please stand for recognition. Thank you so much, board members, for being here with us. This is your function as well. We have the director and staff of Jinja Regional Referral Hospital. All my staff, please stand and wave for recognition. Thank you so much for being part of the organization. We have the district health officers and their assistants and technical teams. All DHOs from Busoga, can you stand with your teams and wave? Yes. Thank you, DHOs, assistant DHOs, biostatisticians, and the district health educators. We have medical superintendents of all the general hospitals in Busoga. Medical superintendents, can you stand and wave? Thank you, Dr. Bameka and your colleagues for being here. We have in charges of health center 4s in Busoga, 20 health center 4s. Thank you, colleagues, for being here. We have our development partners represented here, either by their country directors or chiefs of parties. All health development partners, can you stand? I can see UHA is here, AMREF, Enabel, and all the others, they are here, and they are heavily behind our sitting here today. We have civil society organizations present. You can stand and wave. Okay. We have representatives from Busoga Kingdom. Busoga Kingdom, yesterday the Minister for Health, Busoga Kingdom was here. Okay. We have representatives of the religious leaders from across Busoga. You can stand and wave. We have representatives of the Medical Bureau, Uganda Catholic Medical Bureau, Protestant Bureau, Muslim Medical Bureau. Thank you so much for making it here. We have representatives from the private sector. Private sector, we have private hospitals, we have Kakira Sugar Works, Steel Force Limited, and many other members from the private sector. Can you stand and wave? All right, we have here Nile International Hospital and the others behind there. We have members of the press. Members of the press, I think they are doing their work. Ladies and gentlemen. Honorable Minister, that takes me to my second assignment. Having shown you who is here, I want to, on my own behalf, as the chief convener, to welcome you warmly, and all these dignitaries here present, you're all most welcome for this Busoga Regional Health Assembly. Yes, so I'm going to take us through the overview and the objectives of this assembly. Next. Yes, the one moving slides, can you be fast? Oh, okay, fine, that has been left to me. So this is how I'm going to proceed. I will highlight briefly why we are here today. I'll talk about the objectives and expected outputs. I will say something about the team that has worked together to bring us here, the various participants. This one I've already mentioned, so I will not repeat. Honorable Minister, this assembly is our second regional assembly in Busoga. We had one in 2021 that sat, but 3 years down the road, we have not been able to come together for a number of reasons. But we are grateful that this time round, we are able to be here. It is historic, and we intend to build on this. We intend to have it as an annual event moving forward. The theme of this year's assembly is improving health services in Busoga region through multisectoral collaboration. By the way, we have a keynote speaker, Professor Peter Waiswa. I don't know if he's in. We want to recognize him. Oh, he's right here. Thank you so much for making it here. You are much recognized and appreciated. So the keynote speaker is going to help us expound on this theme for our better understanding. Honorable Minister, the convener for this assembly is Jinja Regional Referral Hospital. And as a hospital, we have been supported by the Ministry of Health, especially the planning department, led by Dr. Sarah Biachika, but also regional partners, especially these ones I've listed here on the screen, are those that have given a financial hand to make sure that we are comfortable here, and so on. So we appreciate UHA, we appreciate Enabel, Local Partner Health Services, EC, MJAB, AMREF, Local Service Delivery AIDS Activity, PMI, MRA, Kakira Sugar Works, Steel Force Limited. Thank you so much. Can we appreciate them? They put resources together with the hospital to make sure this happens. Honorable Minister, Jinja Regional Referral Hospital was established in the 1930s. and that is one of the oldest hospitals in the country, and that has implications, as you'll see. But we upgraded to a regional referral hospital in 1995, and the hospital is 500-bed capacity. Now, the vision of the hospital is to be a center of excellence in providing specialized and general healthcare services for the people in Busoga and beyond. The mandate is, as indicated, to provide specialized and general healthcare. In terms of the specialized services, I'm happy to inform stakeholders here that we are very serious on this. We want to bring specialized services here within the region so that our people don't always have to go to Kampala. This year in June, we worked with the Uganda Heart Institute, and we performed cardiac surgeries here for the first time in June. We operated 8 children that have holes in their hearts, and all of them were managed successfully through our intensive care unit. And I want to report that all of them recovered. They are doing very well in the communities, and we are monitoring them. And we have agreed next year, come May, we will have a second cardiac surgery also undertaken in Jinja Hospital. We are working with the Minister of Health and our partners to also bring dialysis services, because those who need chronic renal care, we have been sending them to Chirudu, to Mulago. We want that to stop. Very soon, we will start dialysis services. I'm also happy to inform stakeholders here that in the recent recruitments, we have attracted specialists in all the specialist areas: pathology, ENT, dental, name it. We are now ready to start the job of providing specialized services in this region very well. We also undertake training. We train interns, we train health professionals from different universities and other health training institutions. We conduct research. We provide public health services. Just this morning, Honorable Minister, you launched Busoga Regional Emergency Operations Center. That center, we can appreciate that. Please clap for that. That's a very big milestone that this morning we have the center launched. It's going to support the whole region and support public health emergency interventions in the region. We also do support supervision to other health facilities in Busoga to improve the quality of services. Now, that's the catchment. We have 11 districts and 1 city, and a total population of 4.3 million people. Honorable Minister, we are the second most populous region in this country after Buganda. Based on the recent census of 2024, Buganda has 11 million, but we are next with the 4.3 million people. So we have a big population to serve. We need your support to deliver services to this population. We also serve surrounding areas that are closer to us, that are not directly in our catchment. We directly, as a hospital, support 10 general hospitals and 19 health center force. And if you look at the health facilities in the region, that is the summary. Honorable Minister, you will see that close to 70% of our health facilities are health center 2s. And health center 2s provide only a small package of services, outpatient services. So as government and as partners, we need to work together to upgrade most of these health center 2s to health center 3s and 4s so that we can provide comprehensive care to our population. As a hospital, we are a regional hub mandated by the ministry to coordinate planning, supervision, monitoring, and evaluation of health services in the region. And it is under this mandate that we have convened this regional health assembly to review our performance in the last 1 year. We coordinate a number of regional health services, including the regional equipment maintenance workshop, the emergency medical services, now the regional emergency operations center, the Busoga local maternal and neonatal services. We coordinate regional partners, blood transfusion services, and other regional programs like malaria, TB, and lab services. So that brings me to the last point. The aim of this assembly is to bring all the key stakeholders in this region together: technical, political, cultural, religious, civil society, and the development partners and the private actors. We are here to review the performance of the districts and the city and the whole region in as far as health services are concerned in the last 1 year, the year which has ended, financial year 23-24. Key issues that will come up here Honorable Minister, they will also feed into the National Joint Review Mission that will be held in October. The objectives, therefore, are 1, to review the health sector performance, as indicated. 2, to discuss and propose mitigation measures for health sector performance bottlenecks that are preventing us really from achieving. We will share lessons learned and best practices in service delivery. We want to establish networks with other regional partners that are key in service delivery. We want to also use this platform to advocate for support for more resources for service delivery. And we have also been able to use this platform to disseminate key health messages, policies, and guidelines. So, Honorable Minister, we started yesterday. In day 1, we were able to have district presentations and also regional program presentations that were made here. We discussed them. Today, we will have highlights of the national health sector performance. We want to compare our region with other regions. We want to compare our districts with other districts in the country. We also have a Busoga regional league table. We have tried to analyze a number of indicators to see which of our districts are doing very well, which ones are not. So you will be able to see which districts are doing very well and which ones are not. Then we will be able to have some discussions. What we discussed yesterday, you will be given highlights so that you understand and know what was discussed. Finally, we intended to launch the Busoga Regional EOC, which you have ably done. Members, can we appreciate the Honorable Minister for launching the REOC? So, as I end, these are the different participants. I've already gone through the protocol, so I will not repeat this. And I want to say something about the organizing committee. As a hospital, we worked with our partners. We had 5 different committees that have been meeting to make sure we have this assembly going smoothly, and the different chairpersons and the deputies as indicated on the screen. In the interest of time, I will not mention those, but this was just to show you that we are not working alone as a regional referral. We work together with our partners and many other stakeholders to let things happen. Finally, I want to acknowledge the Ministry of Health, our health development partners mentioned there, our regional health partners, our district and city local governments, the leaders of whom are all here, religious and cultural leaders, the private sector partners, our frontline health workers who provide the day-to-day services to our population. Lastly, members of the press. Thank you for God and my country.
Thank you very much, Dr. Alfred Yayi. I think he deserves a mightier and bigger hand clap, really. That's the director of our regional referral hospital here in Jinja, and he has done a lot for this place. We like you, and especially the way you coordinate with the local leaders, including leaders of the city, and that's why the city leaders are also here. And the mayor of Jinja City has been ably represented and is here. I think come over and welcome people to your city. Representative of the mayor, that is the Honorable Councillor from Mafubira to Jinja City, Ivan Kameze. Welcome the guests, including the Minister of State for Health.
Thank you very much, the MC for this program. My name is Councillor Kameze Ivan Busoga. I do represent the people of Jinja North Central, that is former Mafubira Sub-County, Secretary for Social Service Committee in Jinja City, representing the Mayor of Jinja City, His Worship Alton Kasolo Okocha. Honorable Minister, we are glad to be here with you. We do take the opportunity to welcome you in Jinja City. Jinja City, it is a place, it's a city where each and every person would wish to stay. And I believe to each and every person who has come here in this workshop of the Busoga Regional Health Assembly is feeling at home. Honorable Minister and the members, we do take this opportunity to thank you all in whatever you are doing in making sure that we make the community, the public, healthy. We do appreciate for the good works, the health facilities, the Ministry of Health, all the departments concerning health, they are doing towards making people live. I will take this opportunity to thank and acknowledge that today, as we are here, Honorable Minister, you started by having a launch in the main hospital over the Emergency Operational Center. We are grateful that has been done. On that same note, I will take the opportunity also to thank the implementing partners which are working with Ministry of Health in making people live. I will take the opportunity to thank the MJAP, Annabelle, and so many others. We are thankful that good work has been done. Honorable Minister, yes, we do appreciate for the good work the Ministry of Health has done, but again, on the same note, we still have some challenges, not only as Jinja City, but for the entire Busoga region. Is when you go in different health facilities, there is still a lot of, we still have staffing. As yesterday when we are here and different DHOs were discussing, really, in every sector you may find that the staffing was still lacking in these different facilities. So there is need to work upon that. Secondly, there also still, we have limited resources like medical supplies and equipment in these different facilities. So as leaders, we call for your support in these facilities. Lastly, Honorable Minister, in these facilities, we are finding certain issues of land grabbing. And this is being attributed to different issues. We do seek for your support that these health facilities get land titles so that these people really, we come to know that these to avoid these circumstances of people coming and taking over land of the hospitals and the facilities where they are being located. So members, on this note, I take the opportunity to welcome you here and also let you know that feel at home, security is guaranteed in the Jinja City Council. I remain Councillor Kameza Ivan Busoga, standing for the Mayor, Jinja City. Thank you very much.
A bigger hand clap for the Mayor of Jinja City, Councillor Ivan Busoga. Thank you very much for that. And did you hear the mayor in the speech thanked all stakeholders, including the development partners and the implementing partners. And the implementing partners are many. For instance, we have got, you said, is Uganda Healthy Activity. And Uganda Healthy Activity, we really like you. You have done a lot, especially in making sure that people can have respectful and people-centered care services, especially in Busoga region. May I therefore invite a representative from Uganda Healthy Activity, one of the development and implementing partners, Mkolo Dr. Augustine Muhwezi. Please come over.
The Right Honorable Minister of Health, Minister of State for Health, Right Honorable Hanifa Kawoya Banjelana, Honorable members of Parliament present here, the Commissioner, Planning, Policy and Environment, Dr. Sarah Biachika, the Director, Public Health Emergency Operations Center, Dr. Isa Makumbi, the Regional Referral Hospital Director and your staff, district officials present, development partners, implementing partners, ladies and gentlemen, protocol observed. I want to take this opportunity to congratulate the Regional Referral Hospital Director and your team for organizing this joint health assembly and also launching the regional EOC. Congratulations. I want also to appreciate the frontline healthcare workers who work tirelessly amidst challenges to save lives every day. Can we clap for them? And specifically when the Right Honorable Minister was opening the EOC, she mentioned that the nurses are chosen by God to serve, isn't it? So let's clap for the nurses who constitute the biggest percentage of the health workforce. I want also to appreciate the different partners and donor agencies who work with the Regional Referral Hospital and the districts of Busoga to build and strengthen a sustainable health system. And specifically, I want to appreciate the American people through USAID. I also want to appreciate WHO, UNICEF, different implementing partners, including FHI 360, the local partner health services in EC implemented by MJAP, malaria reduction activity, local service delivery activity, Mukobadi, G2G, AMREF, Mother to Mothers, Enabel, TASO, UDA, Busoga Health Forum, among others. I also want to appreciate the kingdom of Wachavazinga wa Busoga. I don't know whether the Minister of Health is still here for the kingdom, but thank you for mobilizing the people of Busoga to improve social services. The USAID Uganda Health Activity with funding from the American people remains committed to collaborating with the Jinja Regional Referral Hospital and the different stakeholders in the region to enhance the health and well-being of all individuals in the region and beyond. And specifically, USAID Uganda Health Activity will provide logistical support and ensure that the launched EOC is functional. We have demonstrated that we can achieve a lot if we work together, Colleagues, you remember I've been actually supporting programs in Busoga since 2010, but you remember when we had the COVID pandemic, we worked together and achieved the highest percentage for the second dose in the whole country. Busoga was the only region that achieved over 70% second dose coverage for COVID vaccination. We have also achieved a lot in improving the quality of HIV, TB, maternal and child health, and malaria treatment interventions, among others, but a lot remains to be done. For instance, teenage pregnancy in the Busoga region remains very high, at around 18.5%, and malaria burden also remains high. And we have a number of social factors that contribute to the high teenage pregnancy rates, including education, including poverty levels, including where people stay. So as leaders in this region, we need to work together and address these challenges. Ministry of Health launched a multisectoral approach to address teenage pregnancy in the region, involving different sectors, including education. And the initial pilot is going to take place in Lira, but this needs to happen here. I also want to mention that despite the recent salary enhancement, service delivery gaps still remain, resulting in catastrophic consequences for the people seeking services. And we have many examples here. I will not mention them, but we've reported different incidents here. And the Ministry of Health recently launched the routine client satisfaction feedback. And for the first time, as healthcare workers will be appraised or regularly assessed by people who seek services. And this is going to be an anonymous platform, and the data will straight away go to Ministry of Health, and the different leaders will have access to this information to assess how we are performing. I want to call upon all the leaders who are here to embrace primary health care, to reduce the burden on the health system by sensitizing the communities to take up health prevention and promotion services. Let us all embrace the multisectoral collaboration to improve health services in Busoga region. I say this for God and my country. Thank you.
Thank you very much, Dr. Augustine Muhezi from Uganda Healthy Activity of USAID. There are several medical experts here. It is indeed a healthy assembly for Busoga region. All those that I'm bringing here are specialists in health, in public health, in medicine, like our very own Dr. Alfred Yai, with vast experience and several research, many reads, several citations. He has done research on, for instance, traditional and complementary medicine. He has done research on epidemics, response, and so on, and many others. Now, World Health Organization is also represented. Remember, these are main development partners. They partner with us in Busoga region to make sure health is right. And we have Dr. Kenneth Kabali right here, great expert in health, and he has done a lot, not only for Uganda, but the whole world. May I invite Dr. Kabali Kenneth, please come over on behalf of the World Health Organization.
Thank you, our moderator. The chief guest, Honorable State Minister for Health, the Director General Services, I think we're missing that one, our Commissioner, Health Services Planning and Policy and Development, Hospital Director, respected local leadership, including the Busoga Kingdom Health Minister, distinguished partners in health, ladies and gentlemen. On behalf of the World Health Organization and the broader community of development partners, as well as implementing partners, and I'll just mention a few: Enabel, LPHS, MJAP, LSDA, UPMB, PMI, MRA, JSI, and USID, UHA. I am honored to address this esteemed assembly today. We gather here in the spirit of collaboration with a shared goal of improving health outcomes of the people of Busoga. This assembly marks a significant milestone in our journey towards a healthier future. The establishment of the Regional Health Assembly is a testament to the commitment of the government of Uganda, the local authorities, and all stakeholders to strengthen the health systems in this region. This platform offers and allows us to reflect on our progress as we did yesterday, identify the gaps, and develop strategies to address the health challenges faced by Busoga region. We want to commend the leadership of the Ministry of Health and the tireless efforts of the district health officers, the healthcare workers, and all of those involved in delivering the essential services to the communities. Your dedication is truly inspiring, and it's our privilege to support your efforts. The challenges that we face in improving our health outcomes are indeed complex, but they are not insurmountable. Through the multisectoral collaboration, we can leverage the strength of our government, the private sector, the civil society, and development partners. It is through this collaborative spirit that we can achieve our shared objectives of improving health service delivery, enhancing capacity, and ensuring that no one is left behind. In conclusion, I reaffirm the commitment of the World Health Organization and all development partners to continue supporting the Busoga region in its health journey. We stand ready with you to ensure that every individual has access to quality healthcare services and that health systems in Busoga are resilient and capable of responding to both current and the future health challenges. Thank you for your attention, and I wish us a productive assembly.
Thank you very much, Dr. Kenneth Kabali, and we are certain with World Health Organization, indeed, we shall have the resiliency and we shall be capable of facing any health challenges that come our way. Ladies and gentlemen, remember, we have opened the Public Health Emergency Operations Center in Jinja Regional Referral Hospital, and it was opened by none other than the Minister of State General Duties, Honorable Anifa Bangirana Kawoya, and it's great that we can now have emergency response to any challenges that may be coming in. And right here, we also have the Honorable Minister, who will be the one to open for us this Busoga Regional Health Assembly. I, Kifubangabo Michael, I don't think I'm at the level that can invite a Honorable Minister of State who is opening a Regional Health Assembly, but of course I can get our very own because we have seen her born, married here. We have seen her working here. She's ours, although she's now in the high echelons of the Ministry of Health. And that is none other than Dr. Sarah Biachika, who is the Commissioner of Health Services Planning, Policy and Development. And remember, she was with us all the way. She did internship here. She was in the hospital. She was the deputy DHO, and then she went on and on and on. And then after that, with all our prayers from Busoga, she's in the ministry. And who knows in the future.
Thank you, Michael. Good morning, ladies and gentlemen. And I stand with the protocol already set and use this honor and privilege to invite the Minister of Health, General Duties, Honorable Anifa Kawoya Banjirana, to address the congregation today and officially open the Health Assembly. Honorable Anifa, you are welcome.
Thank you so much, Dr. Sarah Biachika. I have had a privilege to know that once you're a technical person, you remain a technical person. You did exactly what they asked you to do, to invite me. Very mean with your other words. If it was my turn to invite you, you would have had the opening remarks. But thank you so much for being so professional. My colleagues, honorable members of parliament, present here from the Busoga region, all the resident district commissioners from the region, your different capacities, your worships, the mayors present and represented here, my colleagues from the Ministry of Health, from directors, commissioners, the entire staff, and the medical fraternity, mindful of time, all public political leadership from the region, headed by the chairpersons, the governors in your different capacities in your different districts within the region, the entire staff here, all medical workers, religious leaders, and of course, honoring the Busoga Kingdom and the participants and leadership from the kingdom, our media, ladies and gentlemen, good morning. Good morning. You want us to have a break and so that you can have some energy? I have learned that you started since yesterday this review, and I'm happy to say that as a ministry, we are very much delighted to honor and officiate at this review. I want to bring warm greetings from my senior minister, Dr. Jane, and my other colleague, Honorable Margaret Muhanga, who, like me, appreciate the efforts put together by the organizers of this review from the Busoga region, headed by none other than our own Director, Ginger Regional Referral Hospital, the entire team, everybody that has made it to this stage. Thank you so much. We are so grateful. Ladies and gentlemen, my esteemed colleagues and the distinguished participants here, it's my honor to stand before you today during this review to share an insight. As we gather here, we need to share the commitments of how we can improve our health services within Busoga region. I have no doubt in my mind that so far, since yesterday, what you have covered out, you will not go back the way you came in. And I don't anticipate that none has learned from another. Our gathering here brings us to share our experiences, the best practices, even the bad ones we can share and see how we can have our region to move on and focus on. As we gather here to reflect not only on our achievements, but to reflect on so far the gaps that we need to cover, not only in the health sector, but in all sectors within the region. And I want to take this opportunity to thank my colleagues, members of parliament present here, and those who have been here and coming, for sparing time, and you join the region, and you are part of the Busoga region, to find ways to be a party to this milestone. Members of parliament, thank you so much for sparing your time during your recess, and I wish you continue. There is nothing that is very difficult, and I've always told you, the members of parliament, they call me their Senga. Some of them are young, some of them are old to my age, but I have demonstrated that for me, when it comes to politics, I remain young. I've been there for 30 years, and I'm still going strong. And this time I'm taking on not only a male competitor, but a husband of a woman member of parliament. So I need to crush two of them at a go. Why does that one come? You have to be with the people. Members of parliament, you must stay closer to the people. You must be part and parcel of the people's problems, achievements, to find means and ways of bringing up. We are people's representatives. I therefore ask everyone in the Busoga region. I saw my son Mobito. There is a song which I always play. You heard some artists who are saying they didn't choose you, they chose somebody. And when I put it on, so if you don't work hard, other people are there. So it gives me hope when I see you participating and becoming a part of this review. And as policymakers, what comes out of this review, you are the people who are bringing them on board into that parliament to share, to see the implementation. So I urge those who have not yet come, please ensure that they come and they are part of this. Once again, I want to thank our development partners. This is an area that we cannot, as a ministry and government, work on our own. We need development partners to supplement on government efforts. And I'm happy Busoga region, you have demonstrated the strong partnership and collaboration with the development partners. If we can clap for them. I'm very happy that the only way that we can go is to bring the private sector on board. I have had the several issues that have taken place since yesterday. I have listened in to the many meetings from that of the director, Ginger Rifaro, the one who represented the mayor, the issues of funding, the issues of insufficient service delivery. As a ministry, we cannot go it alone. We need the private sector. We need the CBOs. We need the kingdom. We need every stakeholder on board. And that's why we are all here as a Busoga region. Thank you so much. I want once again to say that as we embark on this review mission, it is vital to take stock of where we stand. Where have we been, our past? The director said that you had some time back a review or one or two, but in the middle you did not, and you have come up. So you have to refer in your last review where you were. A lot of things have changed within the country, the economy. We are faced with COVID-19. But I don't think that we should always remain thinking about COVID-19. COVID-19 had its ups and downs, but it had the best. One of the best of the COVID-19 is what we are seeing today, bringing everybody together. There is nothing that we can solve, especially in the ministry sector alone. No one is an expert on any pandemic, any disease. We need to join our hands together. And this is where I want to appreciate those who sponsored, those who put in, the partners, their money, the kingdom, our regional referral hospital. Today was a milestone when we launched the first public health emergency operation center for Busoga region. You may just see it as something small. Now, this is a real center that will first of all address the issues that are before us. It is a center that is going to be the epitome of ensuring detection, early detection of each and every pandemic in the region. Early warning, early control, management. And I'm happy and I want to thank you that during COVID-19, as a region, you came together and did all that you could do unreservedly to ensure that the COVID-19 pandemic was managed, controlled in the region. As a minister and government, we are grateful, of course, with the entire medical staff and everybody. Thank you so much. We had Ebola. You had to be alerted early enough that Ebola was in Mubende, but it did not stop all of you in the region to be alert. So the center is here purposely to ensure everybody is on alert. You have had malaria in the region. Now, this center is an early warning center that if the malaria is highest in Mayuge district, for example, any other disease, pandemics are now becoming, even malaria itself is another pandemic. So the rest of the districts, every district in this region must be aware, must be alert that what has befallen our neighbor can cross over to us. For us, we always think about cross-border pandemics or diseases, but we are not giving it time to look at our neighboring communities. That's why you'll find that a certain disease has started from one district, it spreads to another one. By the time we come in for prompt action, vaccination, it has spread. So this center is one of a milestone that you have achieved in the region, and it's our humble prayer and request that it will strengthen the enhancement of our service delivery within the region. Having said that, I also want to say that the issue of data collection is very important. Data collection, data transmission, data utilization. When we talk about data, we are saying information. The center is going to be the center for collecting our information within the region. when you collect this information, you must immediately, as a priority, that is why it is called emergency, pass it over. I am happy to learn that recruitment has been opened at every district center. There's going to be an availability of an officer who is going to be in charge, meaning that there won't be a gap breakdown. Honorable colleagues, I'm sure this is one thing once you return back to say, in the Busoga region, so far, so good. Because all these diseases, once we have the data, once we have the officers committed, the chain of information flow is very important. Because from this center, it will go to all the district centers. It will go to the Ministry of Health. It will go to where we can plan maximally and ensure early action is taken. So I want to congratulate you on this center, and I want to wish you the good use of this center. I want to say, as the director has said, multisectoral collaboration allows us to leverage resources, share knowledge, and create comprehensive strategies that address the social determinants of health. For instance, improving access to clean water. We have to be, the health cannot go on its own. Education, because as a government and ministry, our policy now is preventive is better than a cure. We are focusing more on prevention. We cannot say treatment. If we have to go back to the communities, and I want to thank our policy planners at the ministry, Dr. Sarah Biachika and your team, Engineer Otim and your team, for ensuring health facility development towards the people, the community. There is no way we can have the people from Mayuge coming to Jinja Regional Referral Hospital if, as a government, we strengthen those facilities down. A referral is a referral. You are being referred for a case that cannot be managed at a lower facility. Yes, we have insufficient funds, but if we can strive whatever small funds we have to strengthen the health centers at the sub-counties, health center force, so that we decongest the referrals, so that these referrals also act as centers of excellency to manage very difficult issues. And that's where we are focusing, and I want to thank the government for that. And we need to equip all these equipment so that our people are told, and confidence is built within our people that you can be cured, you can get treatment, you can be managed at a lower level. So I want to thank everybody and ensure that we reflect into that. Yes, Busoga region, in terms of the health service delivery, much is still needed. And it is my hope that when we are walking out of here, we shall walk out with some solutions and way forward. I'm one person who does not agree or accept challenges, as I've told you. But the challenges are a necessity because it's one that gives you an opportunity of waking up and finding that, yes, there is something that I must tackle. Imagine if you went to your office with your jacket, you remove your jacket, is your tie, I'm talking for the gentlemen, the ladies, you can ease whatever you have as a necessity, and you embark on your work. At the end of that day, you put on your jacket, get your computer, your keys, you go home. But inside your own, your heart is saying, today I have done a good job. You don't need somebody to appraise you. The moment you wait to be appraised by your immediate boss, you have already failed. You went to school alone. You passed alone. You are in that field alone. You must ensure that competence of what you are doing is from you. and you must be satisfied with what you have done. But if you want to wait for me, the minister, to come and appraise you and say, gentleman, doctor, you have done well. Now, you have proved you're a good administrator, director. Now I can confirm. So you needed me to tell you organize. Some of us, like me, to get my thank you, you have to work for it and sweat. So ensure you are happy with what you are doing. That's what is important. And in the Ministry of Health, there is no satisfaction other than you satisfying yourself that I have done a good service. To save the people, every person has a right to have a right for human care. I'm seeing Dr. Makumbi saying now Dr. Nifa is taking advantage of me. Yes, I am learning that we are here to give a service. And a satisfactory service is you yourself who gives it. And when you go home, you say, wow, I think I have had a very good day today and done my best. Therefore, every issue within this region, any health issue, let it be sector-wise. Yes, the government, the economy is not good, but within the little resources we have, if we manage it properly, it can be put to good use for our own people. Therefore, I don't want to discourage you with the several challenges I have seen, with the several problems that are in the region, sector, health, education. Together, we shall achieve to our progressive where we want Busoga to be. I listen always into the Busoga anthem. If you analyze it, it is a source of encouragement to the people, to the Busoga population. And I salute the kingdom and the king for that it gives you hope that you have a strong region. Very committed to solve the problems. These problems will not be solved by another person other than the people from the Busoga region. And I'm very happy that this is what you have started or you started. They are the problems known within the region. They are the problems which can be solved by the people within the region. And the people are here. You can imagine, you have your own Sarah Biachika, a doctor. I had another doctor, Biachika, another Biachika. All doctors are here. I have seen the professor who is going to give a keynote address. For us, we can only come in to supplement on your efforts. In Buganda, we say, Nanye ne mufu, yakwata waunya. You must start. Government comes in with finances. You can even, with our development partners, mobilize resources like you have done. Many things have taken place. And I want to thank the Right Honorable First Prime Minister, who has been our long-term serving Speaker, Honorable Rebecca Kadaga. If I don't say thank you to her before you, I will not be doing a good service. She has committed herself to this region. She has committed herself to speak for this region. In every cabinet sitting, there is an issue about Busoga. Every cabinet, there is an issue. And you remember, she's not a simple lady. With her vast experience, she has the region at heart. So you have many pillars. You have your members of parliament, and they are working as a team. You have the political leadership, political will within the region. The region is stabilized. You have your RDCZ to supplement. You have the technical people to work together. What am I driving to? Teamwork. partnership within the region. Teamwork. Work together. And wherever there is any issue, there is nothing that cannot be solved. It is therefore my humble prayer that I want to look forward together, of course, with the ministry to see where there are gaps they can be bridged, especially in health service delivery. We can only work from these outcomes of this review, and we shall have them reviewed at our top management meetings as a region. Because you are now working together as a region, you are looking at issues as a region. You are not just taking piecemeal. So I am sure that once we reach in our top management where your only daughter with a conflict of interest, we shall discuss, and I promise you the outcomes from here, we shall give them a priority at our top management meeting. I am a community mobilizer. I am a politician, long-standing, but I'm pro-people, which is very important. I don't want to reach, when I'm there, I'm not a technical person. My glasses have to go through to the people. So my glasses will have to go through to what are the outcomes of this review. What are the issues that this review has come up with? So I'm going to be your voice. Opening here is not what is important, because now I am aware this is what it is. I am aware this is where we are going. So you have added another voice to the voices of the many people who are gathered here. As I conclude, I want to ensure that the strong partnership that you have with the ministry, the strong partnership and collaboration with the other partners, development partners, the CBOs, our civil society people, they are very, very important. With the teamwork, we shall ensure that there is improvement and enhancement of the health service delivery in Busoga region through a multisectoral approach and through to see how together we can have a region that has come out strongly to ensure the well-being of its people. It's my humble prayer and honor to declare this historical milestone review concern of the people, population of the Busoga region as they forge way forward to ensure service delivery in the health sector and other government sectors, and to see the well-being of every people in the Busoga region. I saw here declare the review, Busoga Regional Health Assembly review opened by none other than me, the Minister of State General Duties. But now I'm here as a minister. General duties, I'm everywhere, but not like UPs which you had. But now, as a minister, on behalf of my ministry, I declare it open, and I pledge my personal ministry and government support. Thank you so much for God and my country.
Another very big round of applause for the Honorable Minister, Anifa Bangirana Kawoya. And indeed, our theme, as she sits, we cannot stand up. We cannot stand up. That is our minister, and long-serving, she told you, and experienced, was a speaker at the district, was the RDC, CA, she was there, member of parliament for a long time. Oh, I stopped there. I stopped there. Now, since we are standing up, could we all, a center has been opened up in the regional referral hospital. Could we all with both hands outstretched. Point to where you think that center is built. Outstretched hands. And then we point where it is. Where do you think it is? With outstretched hands. Okay, so that is the direction. It's multi-directional, like multisectoral. Okay, could we all now point to the direction of the district where you came from? Are you a DHO, a cow? Are you an RDC, or are you born from which district? Thank you. Who can guess the district from where I hail from? Try to point there using outstretched hands. Thank you very much. Thank you very much. You can sit down. And we thank the Honorable Minister for that pledge of support. We are very grateful. Remember our theme, improving health services in the Busoga region through multisectoral collaboration. And that is today. So we have a keynote speaker on that theme, improving health services in the Busoga region. Remember how I feared to invite the Honorable Minister? I would not fear to invite the keynote speaker. After all, he's ours. I have a niche. I was given a small niche in the clan. Our speaker today on improving health services in the Busoga region is a born of here, from Tabingwa's land in Luwoka, educated here in Luwoka, in Iganga, in Ibudini, in Jinja College. A man who went to Mbarara University, went for Master in Public Health, knew Hebrew Jerusalem Institute, that is in Israel, and then Karolinska Institute of Sweden, Stockholm, partnering with Makerere University for a PhD. So he's doctor, because he has both the medical and also the PhD. And that is none other than professor. When I say professor, he's associate professor in Makerere University, College of Health Sciences. When he was appointed, he had over 60 reads. Now it is over 120 peer-reviewed publications. Until he arrives here, I'll keep praying. By the way, in 2020, he was appointed on the World Health Organization Strategic and Technical Group of Experts on maternal, newborn, child, and adolescent health. He's the expert.
Thank you so much, Mr. Chifwangabo. Honorable Minister, I'm hoping you are going to listen to me. Okay, so I'll miss you. So, the members of parliament present, including my own member of parliament, Honorable Mbayo, and commissioners present, Dr. Vyachika, Dr. Makumbi, and RDCs, COWS, directors, and the director of Jinja Regional Referral Hospital, but I'm standing on protocol. So I've been asked to give a keynote about the multisectoral approach. I hope I can be able to use this. Yeah. So I wanted to start by showing you this document. This is a document you can download. It is by WHO. And it is a new strategy now. It says systems for health. Everyone has a role. And maybe with that slide, you could potentially say my presentation is over, because it says we must put health in all systems, and everybody has a role. So that is going to be the main emphasis. Really, the aim of my talk is to make a case for this in the Busoga region, but indeed, many other people who have spoken before me have actually made the case. And as already said, Busoga is a big region. Dr. Biachika, I always say that we should always look at these regions as states, because in about 15 years, Busoga will have a population of 10 million people. And the standards have to change. So we have to prepare and plan for the future with this growing population. By the way, even if fertility goes down, the population will grow because people will still give birth, since there is a large base of young people. This Busoga is an island. Actually, recently somebody said that every village in Busoga is separated by a river. And those who come from Busoga, you can go back to your parishes and see that every single parish is actually separated by a chibali or something of sorts. But Busoga is an island surrounded by Lake Victoria, River Nile, Lake Choga, and River Mpologoma. And those are very good conditions for everything to thrive, both human beings, but also germs, including malaria. So in terms of health, we have an opportunity, but also a challenge. And this is still showing that island of Busoga, which is currently estimated to have 3 million people. Now, I know that they are going to be presenting data on the performance of the region, and I've not seen the data, but at Makere, at the Maternal Newborn Child Center of Excellence that I lead, we've been looking at data, also data in Busoga, but actually, by the way, I'm also the chairman of Busoga Health Forum. So I have some data about Busoga. And yesterday we had a talk, we had a webinar on how can we use routine data to estimate what is a population level performance of regions and districts. And we used some of these slides. Actually, these were presented by the Minister of Health. And when you look at a few indicators that I'm going to look at, antenatal care, Dr. Biachika, this big red, which is in regions which should be doing very well, is a big problem. When we see Kampala, Buganda, Mukono, and Busoga doing badly, it is a very big problem for the health sector, because that is where the majority of the population is. People in the region are not attending properly the first NC on time. Then when you look at 4 NC visits, again, the region is in red. And now, if you don't attend antenatal care, you know the consequences. And I know that I've been sitting with the director, the people in Jinja who are, Dr. Mond and others who are leading a lot of work, and UHA and others, on maternal health. But you will see that the red, which compared to 2019, has even become bigger and persisted for antenatal visits. So a region that is not improving, and I'm not going to be ashamed to show that it is not improving. And also when you show maternal health indicators in general, again, it's a region, there is some improvement. By the way, I must say there is improvement. But when you look at Uganda overall, there is a big challenge, and it's affecting the performance of the country. So without improving Busoga, you cannot actually improve Uganda because of the population. This is about institutional delivery. Now, the Busoga issues seem to be spreading to other regions, as you can see. This red going from Buganda into Busoga, Bukedi, and up to Karamoja, places getting worse. Here you can't see maybe very well, but when you do regional ranking, then according to the data we have just used for Makere, then you see Busoga is down there in terms of maternal health. So even if we are doing efforts to improve, I think there is more, and that's why a multisectoral approach is very important. This isn't just in terms of graphs. You see that in the next slides, I'm going to be presenting Busoga on the extreme, I think left, my left. And the middle, we'll be putting the best performing region. And then on the right is the national estimate. 4 NCVs I've presented. You see Ankole is far there. institution delivery, Busoga and national average are the same, but of course Kampala is almost universal. And in terms of teenage pregnancy, Dr. Mhuez gave a figure, but which was a bit lower, but still national estimates show that almost a third of teenagers in Busoga actually having deliveries or getting pregnant, which is a big problem. In terms of fertility, Busoga is even higher than the national average. It has quite a high. Dr. Biachika, when I said, and I'm going to mention Dr. Biachika so many times, because she's the planner and for the ministry. So in terms of fertility, Busoga is not improving. So the population is going to, and the burden, the population comes with the burden. Dr. Yaya, you'll see that for all the efforts you are doing, we shall need more beds for delivery because the base is increasing. All these young people are going to grow in 5, 10 years to give birth. And you have to ask the question, where are they going to give birth from? So you have to prepare for that. But there has been some efforts in contraceptive efforts, and we thank all those who have been working here. We have Busoga actually is higher than the national average and almost chasing Kampala. Now, in terms of immunization, as you can see, this is Penta, and you find that although we are not complete in red, but we are not green, and compared to 2019, 2 years later, the region needs to improve. This is malaria. Now, the number one problem of Uganda, apart from our own ignorance and not improving ourselves, is actually malaria. And malaria has consequences for everything, keeps all of us busy with its consequences. Our children also don't perform, and they get stunted, and stunting affects the brain. And malaria is big. Now, Busoga has one of the highest prevalence. Not the highest, but because we have a very big population, we are the region at the highest risk of malaria in Uganda. And it's because of the island I told you. And of course, what we are doing with also the island, the swamps and stuff. So right now, we are working with Honorable Speciosa Kaziwe and Busoga Forum to actually make a case for eliminating malaria from Busoga as an example for Uganda. So like all your support, we are trying to do a multisectoral approach, and we're inviting the ministry to completely support and all the partners. And this approach is actually bottom up. Now, the consequences of malaria come with anemia. This is an old map, but it has not changed much. Again, Busoga is in red. Children in Busoga, Honorable Mbayo, the children in Luka, Awaife, and elsewhere, just walk with malaria everywhere. And even if you might see them playing around, they have parasites in them, and those parasites don't help them to perform in terms of schools. So without addressing these issues of malaria, then you cannot make progress. But Busoga also has another big problem, sickle cell. In fact, the Chabazinga says and is worried that his people might be finished by a sickle cell. Where Busoga is the region, almost the second one in the country leading in sickle cell. Sickle cell has the same consequences as malaria, and it's big. And Dr. Yai has very little to do on sickle cell other than treating babies who are anemic. But the rest is an effort that needs to be done by multisectoral approach. We just did this figure and again presented it yesterday. We are looking at perinatal mortality. And I would like to congratulate the region. Not everything is so bad. There has been a lot of effort around by many of us and others around maternal health, Dr. Mhuez and his team and others. And we've improved a bit in terms of perinatal mortality. But actually, even when you look at, later I'll share another map, maybe I think it is this figure here. Even institutional maternal mortality, the region has improved. It's in the middle. It's no longer really the worst. So I think this shows that something is possible when we work together comprehensively on an issue. That is one of the key lessons, that we need to be comprehensive and we need to be intentional. There is there is, I just wanted to emphasize this, that whereas we've made those progress in maternal health and perinatal a bit, but in terms of children dying, the only region that competes with Busoga is actually West Nile. But you know, somebody needs to study what is happening in Teso. Teso is the only region in Uganda which has consistently, the last 20 years, had the lowest child mortality, but also stunting. And we try to study it in Makere, although we are yet to get a proper answer. But I think Busoga needs to make a trip for child health to Teso, who are our neighbors, and ask what do they do right in that region. But one of the critical things is their feeding practices, and also hygiene, which is multisectoral. Those are things the people from Teso do very well, and you see that their child mortality is actually moving towards achieving SDGs. So you find that from my presentation, we have a region which has problems, and they are a lot grounded because of our location, but a lot because of what we do and don't do. And therefore, we need a multisectoral approach. I've given those case studies, but recently, I usually go to the field in this region, and I want to give you 4 case studies and see whether even Dr. Yai can solve this problem. I found a man in Luka, 25 years. So far, I had 1 child, which is maybe okay, has no land, but he said his income is only 20,000 per month, and he buys food. He doesn't have land. How can you use 20,000 to feed your family? Dr. Yai, this person will always come to you with malnutrition. Then I went to Mayuge. We have a project we've been doing here. We've developed a tool with the Ministry of Health and Johns Hopkins, which uses a computer to characterize mosquitoes. And recently, Bill Gates actually wrote about it in his newsletter. But when we went to Mayuge, we went to a household where every night we are capturing mosquito, and the children had been beaten every night. There was only 1 mosquito net. And when they fall sick, they go and get treated. They come back even that night. They get bitten by mosquitoes because they are not using nets. I think we need to see, the Ministry of Health is not going to go to those households and put mosquitoes over the nets of those children after they have delivered the mosquitoes to them. Committee members, you must come up and get your people if people need to have health children. Then I also went to my former primary school in Naigovia recently, and we talked over 200 children. Those 200 from P5 to P7, nobody could spell the word pupil. They can't read and write. People who can't read and write, how can they do preventive health care? So multisectoral approaches, how about if they give birth, what would they do? Then also, imagine a pregnant woman coming from an island in Amayingo or in Mayuge at night. We need transport, we need communication, and they will be referred up to Dr. Yaya. And by the time they arrive, they will be actually either the baby is dead or the mother or both. So multisectoral approaches are the things that we really need to do. So as I said, in Busoga, we have big problems because the fundamentals are not right. We are located in a region which is naturally at risk of disease. And also, people can actually multiply a lot. It's a region, Dr. Biachika, we are donor region, maybe not donor region anyway, but we are a region with 4 million people, but with 1 odd, sorry to call it hospital, but the truth is true. You cannot change it. With 1 odd regional hospital, with most of their buildings actually not fit for purpose. And by the way, I speak straight, so you excuse me. That's the reason I'm in academia. So not fit for purpose, they need to be removed and rebuilt. And because I'm told by Father Kayaga, who is from here, that that hospital was built as it used to be a barracks. Does anybody know? It used to be a barracks during the World War. And when the war ended, that's why there is a cemetery here. They made it a hospital. So it's not fit for purpose. It needs to be rebuilt. it's that rebuilding has delayed. But also we need a second regional referral hospital. We've been advocating for this for a long time because the regional referral hospital comes with opportunities. It will come with a better budget, with better human resources, better standards. So leaders here and all of the MPs, we have engaged you on this, but please push it. We know the economy is difficult, but we need to improve health. So the way to improve health is to improve it in Busoga, then you improve it for Uganda. We've not been having a blood bank, but thank you, Minister of Health and partners. I understand this is taking off. We've been engaging on this issue. And also, we don't have a public university, but I understand it's coming. Again, we're engaging with the hospital and others to make sure that we also have a health institute in the region, because that will come with benefits. And then the political leadership. And for the politicians who are here, thank you for coming. Let's clap for them. Yeah, really big, because the main problem is political in this region. A few years ago, I hosted a meeting where we invited all the MPs and the RDCs and what. And I think in that meeting, we got the RDCs, the cow, the chairman, but only one MP came to the meeting. And by the way, sorry for what I'm going to say, honorable MPs, for you are good, you are here. But others, we are telling my colleagues that let them first send us our transport or stuff like that. This is a big problem in the region, and even today, we don't have all the politicians. Without them, I thank Honorable Kawoya for really spelling out why they must be here, and I also want to join her to thank Honorable Kadaga for what she's been doing, and others, and the MPs definitely who are in the room. Because without MPs, and of course not only MPs, the district chairman actually have the primary mandate without being active, and then the local leaders. Let's forget health. These people have done everything, the health workers, but they cannot feed people at home. That is not their job. There are so many things they cannot change. So political leadership is going to be very, very critical if we want to change a region. And by the way, I have a brother who is an MP, he's also not here, but he traveled to Tanzania to represent Parliament. So maybe I'll give an excuse for him, but I'll tell him the same message. Yeah, Honorable Luke Chove. So, and that is what WHO did. WHO said a health system, WHO defined a health system in broad terms. It said a health system is not hospitals, it's not clinics, a health system is not Ministry of Health. It said all organizations, all people and actions. So all people like politicians, like people in the private sector, and that's actions like what the politicians do or radios do. So Chifanga, thank you for being here. Whose primary intent is to promote, restore, or maintain health. So if you make it intentional that in your actions you want to promote, restore, or maintain health, then you are actually pushing for health care. And those actions are more powerful than hospitals. This is what the Western institutions have done. They have addressed those issues. The goal is to improve health and health equity. You cannot improve health equity through the Ministry of Health. That's a lie. Health equity is an issue of politics and leadership. So if we want to achieve the benefits of a health system, so health systems are said to have building blocks. I will not go over the building blocks, but I just want to emphasize that the building blocks as defined alone are not enough. Just look at the arrow from the bottom. The arrow from what I'm going to show. The other up there is the building blocks. That is what Dr. Yachika and Dr. Yayi do. But they are not enough. What happens is outside the healthcare delivery system, the environment, the politics, the policies are so important in determining health. This is what Western institutions have beaten us. They have worked so much. Health is at the top of every political issue to address the social determinants of health. which cannot be addressed by Dr. Vyachika and her ministry. They can only be addressed by good politics and leadership, those social determinants. As long as they remain, then the system is not going to is not going to deliver. These health systems are complex. They need, their building blocks always interact, they are complex. And without good management, it's impossible. And management is also a multisectoral issue of the health system. Because of time, I'll be jumping a few things, but what happens is, what action taken by people in leadership is so important in influencing these health systems on how they perform. So politics, policies, governance, management, accountability are so important to make sure that people are served in the right way. If you make health a mandate of everybody, then like the WHO document said that it is everybody's business, then we can change healthcare in the region. So I'll just jump this. But I want to say, again, go back to that side, that these building blocks, which Dr. Vyachika is in charge of and that team, we can try to manage them, but I just want to end with a circle outside that system, just to emphasize that as the healthcare people do their stuff, there is meant to be that circle around their work. And that circle has things like environment, has economic issues, has leadership issues, education, and more. This is the multisectoral approach. Dr. Vyachika and Dr. Yai do their job, but really using a platform provided by the political leadership that is in place. If you don't, you will continue going to go and bury and send Ezekiel and also people, because they are sickly people will always be poor and will always be poor. So then what can we do? We need really politicians in Busoga to come on board. The opportunity, Busoga has the Busoga Consortium for Development. And I know Ala this year, he was here, is a member and several people. And I hope that is the opportunity, but does it have the political weight enough? And then Obachabazinga, of course, it's a great opportunity. We need to support it and to make sure that they are able to mobilize the region, because who is going to mobilize and speak for the entire region? It cannot be Honorable Kadaga and a few other people alone. Then when we have data, Dr. Yai and team, this data must be put in a simple way in which my MP, Dr. Honorable Mbayo, can understand it. Does she know how Loka is performing and what she needs to do? I think we must have used data meaningfully. Then we need to innovate by making health everybody's business. So schools, there is actually a WHO strategy called Health Promoting Schools. Can you imagine if all children were healthy and we teach them to go and teach homes and communities? I think that's an opportunity to go. It's great you brought Mr. Chifubangabo here. And I think he's doing a job. What do they do on the so many radios and TVs in the region? If we give them the messages, then they can push them. And I think they agreed it is up to our job to give them that information. Then the bottom-up approach. So I said, for the malaria stuff, Dr. Kaziwa has been going to LOCs, to traditional leaders, to who, to mobilize. Until we make, I actually call it that we must democratize. I think that's the term. Because when you look at health, Dr. Yai, you think, what is your main job? Your main job is to actually manage the hospital, to treat people. But the other things like educating people on malaria can be done by anybody. How to feed a child can be done by anybody. I call that democratizing health so that everybody, but we must give them the information they need. I end by bringing this thing of Professor Maswa. He said health is made at home. And I want to add, and in the community. And the hospitals are only for repair. So many years ago, Professor Maswa gave you politicians this mandate, and always reminds you that the primary making of health is actually with the leadership and communities and what we do in there. That's why for us in Busoga Health Forum, we actually, officially, the implementing arm of the Wachabazinga. This was given to us by the Prime Minister. And we're already working with all the DHOs in the region and all the hospitals. We've done a number of things. We are engaging so much with Dr. Yai and his team. Dr. Yai, thank you for his leadership. By the way, thank this man. It's been amazing. We are developing a multi-sector strategy for children, women, and younger people of Busoga. USAID is supporting us. And also, we organize a Royal Medical Camp with the Wachabazinga and also Ginger Hospital and partners. And we're organizing a camp at the 10th anniversary of the Chabazinga. So there are things Busoga Health Forum is doing, is educating the country. So far, they have reached almost 4,000 health workers with CMEs. Dr. Vyachika, you should be thanking them because they are doing it on behalf of the government. Let's clap for Busoga Health Forum for the job they do. And to end by saying, again, WHO says now it is systems for health and it's everybody's business. Just leave you with some pictures of the medical camp, which we need, treated over 10,000 people as a multisectoral approach. And also here, Busoga Health Forum Board meeting the Chabazinga, meeting us, and also leave you with a beautiful wedding. So thank you so much. Multisectorality is what we need. Thank you, and I hope we can do it in Busoga.
A big hand clap for Dr. Peter Waiswachove. And ladies and gentlemen, next is a photo moment as we go. We are going to have tea. It's ready. And I'm certain we shall be having a working tea. So we'll first come over for photos. I ask Dr. Ayai, the director, the Minister of Health team, Dr. Vyachika, the members of parliament, Honorable Nakato, Honorable Chebakutika, Honorable Mbayo, Honorable Loy Katari is also. Please, a photo for MPs here, in front here, then Minister of Health, then we shall have the local leaders, LC5 Sandara DCs, Mukulu Richard Ibaryaino Gurume, we coordinate them, including the assistant RDCs, Mukulu Waiswa Paulo, who has represented Sarah Birungi of Kamuli. Then after that, we have the development partners, World Health Organization, Annabelle, USAID, yes, there. And then the one in charge of photos, please direct, do the direction, give guidance. Then we shall have the chief administrative officers and technical staff of the districts, then the DHOs and the ADHOs, the district healthy officers and the assistant district health officers. Good, that's great. The members of parliament. After that, the Minister of Health team. That is the Minister from Minister of Health. And then RDCs were here. And the LC5s, same photo. LC5s and RDCs. I can see Mukulu Waiswa Paulo of Mayuge and Mukulu Waiswa Paulo of Kamuli Assistant RDC, Chairman LC5 Elijah Kusoka Kagoda, who is also chairperson of the chairpersons of the district, Honorable Michael Kanaku. Yes, Michael Kanaku. from Michael Kanaku. From Buyende, I can see Tasibula Angwanga. From Mayuge, Aradisi Mubito, Madam Aradisi, yes. Thank you very much. Aradisi Kato, my student. Yeah. Yeah. Don't go before you see the flash. Good. And then we shall have the chief administrative officers. And technical staff with the DHOs. DHOs, understand DHOs, your photo here for the Busoga Regional Health Assembly. Regional HOs, development partners, and DHOs, development partners, World Health Organization, NABL, PMI, MRA, LSDA, private sector. I can see Busoga Health Press Association by Mukasa Julius and Asimwe. Development partners and implementing partners. Implementing partners and private players like Busoga Healthy Press Association, enhancing health. You can see, I don't know, Faizo from the Journalists Association of Health, Busoga Health Press Association. And then development partners, yes. Then DHOs and assistant DHOs. Okay. They're ready. DHOs, understand DHOs there? DHO from Bojere, Mukurukiria, DHO Luwuka, DHO Buyende, after this now, we can stretch and go have a cup of tea, and thereafter we shall come back with the cup of tea and have a working break tea, where we shall be now listening to the National Health Sector Performance Review for the year 2023-2024, and then we shall get the Busoga Regional Health Sector Performance for the year 2023-2024, so that we can compare the two. And after that, we shall discuss it before going over to looking at the best districts. Out of 12 districts, we shall have the best districts giving us their best practices. How do they do it? How come they are best? By the ranking out of the 12 districts. And then our chief guest will be here after that, and we shall have a closing ceremony. So please, let's go for tea, and I think it is way behind me. 70%. In the others, average, in the others, below 70%. So it's good that we have all the data here. We thank all the records people, the biostatisticians from the various districts. And remember, this Busoga Regional Health Assembly is not the first. We had a regional health assembly in Mbale covering the districts of Okedi, of Sebei, and of Gishu. And now we are here for the Busoga Regional and other health assemblies from various regions. And thereafter, a national assembly will take place. And at that national assembly, I think that's the right point where we shall have the national health sector performance for the year 2023-2024 presented. However, for today, we really want to know what is the sector performance in health in the region of Busoga, and you cannot ask any other person about the Busoga regional health sector performance other than the person who is at it. The biostatisticians of every district know that, and the good thing, they also have their association. And today, the one I'm calling upon to come and present to us and give us the statistics. How is Busoga? How is the performance 2023-2024 is none other than our very own. Our very own, I mean, is from here in Budondo, in Busoga, and is going to present the Busoga Regional Health Sector Performance for the year 2023, and is biostatistician Ali Kizito. Please, you are welcome. And he's also, by the way, Ali Kizito is also the Minister of State for Health in Obwantembe of Butembe in Busoga, Obwachabazinga of Busoga. So, Owekitiwa, you are welcome. Come and give us the Busoga Regional Health Sector Performance, knowing that finally we shall have the National Health Sector Performance for Uganda 2023-2024 at a National Assembly, this being a regional assembly. Wanange, there he comes, Mukulu Ali Kizito, all the way from Namaingo district, but presenting for the whole of Busoga region. You are welcome.
Thank you very much, the moderator, for this health assembly. Allow me to say, protocol observed. Good afternoon, ladies and gentlemen. The task I have is very simple, is to present to us how the various districts have performed. Here we looked at 15 indicators, though we are supposed to have 16 indicators. And allow me to go through indicator by indicator. The first indicator is approved staffing norm. About the staffing norm, the source of data is the HRIS, Human Resource Information System. And before you, our staffing level is reflected to be higher because the system has not yet been upgraded to read the new structures for the Health Center 3s and the Health Center 4s. Therefore, the staffing level here is as of the old staffing structure. Important to note, we have districts that are doing well, like the districts of Jinja City. They are above the regional average as far as staffing levels are concerned. The districts of Iganga, Kamuli. However, we have districts that are doing badly as far as staffing levels are concerned. The districts like Buyende at the districts like Buyende at the 67%, having 3.4%, 4 points out of the 5. Those ones, if we really look at the new staffing level, you will find out that they are doing so badly. And I want to let you know that as we tried to compute using the new staffing structure, on average, the staffing level in Busoga region is at 38%. You can imagine how the staffing level that we are working at. The second indicator is DPT coverage, that is within immunization. You note that regionally we are doing well. Out of the 5 score, we are having 4.5. However, we have some districts that are doing poorly, like the district of Jinja district. And this was attributed to during the financial year, the last financial year, this district was implementing the digital reporting using the STP reporting tools. And this affected, later on, that system, they were asked to change to go to the other system of DHIS2. Then TB notification. I want to thank our implementing partner. When you compare the league table for last financial but one and this one, TB notification is where we performed poorly as a region. But as I talk now, because of the efforts of the IPs, we have really improved. You see all districts have scored the 5 points. Thank you very much, the implementing partner, especially the MJAP. IPT free coverage. This is out of 10 score. Regionally, we have scored 4.6 the scores. You really see that we are doing badly. So this is, as you are seeing, it is highlighted in red. It means a lot of efforts is needed to be put together so that we improve the IPT free coverage. ANC4 coverage. About NC4 coverage, we are doing poorly. Our mothers are not coming. They are coming late for ANC services. You find out that they cannot even make up to 40 visits, meaning some of them even come when they are going to deliver, that they have come for ANC. So you can imagine the maternal death cases that we are always facing in the region. So districts like Jinja, we want to thank you. We want to appreciate you. Okay, thank you. Okay, thank you. Districts like Jinja, all their mothers came for antenatal. Jinja City, all their mothers came for. However, for Jinja City, this is a district where we have the regional referral hospital. And I want to request the Ministry of Health here. Of course, we follow the guidance from Ministry of Health when we are coming up with this. We have followed what they have been doing to come up with this. They have not been removing the data for regional referral hospital. And we want to request to have a fair representation of Jinja City, to always remove data for the regional referral hospital, and we really see how the district is performing. Health facility deliveries, the deliveries that are conducted from health facilities. As you can see very well, it is very, very important to deliver from health facilities. And the score is 10. It's out of 10. And as a region, we scored 5.9. meaning a lot it needs to be done. If you are getting 5.9 out of 10, you are below average. Because the national target is 70%, so we are below the national target. So a lot of effort is needed to see that the mothers deliver from our health facilities. However, there has been an improvement. There have been an improvement as you compare with last year, but one performance. So therefore, we need to thank our implementing partners, especially the UHA pattern. They have really made a lot of efforts to see that our mothers are delivering from health facilities. Under 5, vitamin, second dose. The score is 5 out of 5, but we scored 3.7. We have districts that are doing very well. Ginger City still doing very well. Luka doing very well, getting 4 out of 5. Namutumba getting 4.5 out of 5. They are doing well. So, colleagues, as we are seeing here, we are seeing areas where we need to put a lot of efforts. Percentage of pregnant women tested for HIV during the current pregnancy. Out of 5, regionally, we got 4.8. We are doing very well in this area. Thank you very much, team, in this area. ART veiled suppression rate. Our suppression, I know very well that our political heads, they know about the 95, the United target. So as a region, we are having 96. So we are doing well. However, we need to have 100% now. We should aim at 100%. DPT1 to DPT to MR dropout rate. The dropout rate, those getting DPT1 as compared to those getting measles. Here, the bigger the dropout rate, the lower the score. And as a region, our dropout rate is 5 out of 10, we scored 5.8. It should have been in red because we expect all of them to come back and get the service. They are getting the service, but coming back is becoming a challenge. Why? That is where we normally ask the why, until we solve the smallest why. Maternal death review. These are some of the areas where we scored poorly in the previous financial years. We could not review the maternal deaths that have happened, but these days, review are always done. I want to thank our implementing partners, especially the UHA. They have put a lot of efforts to see that districts are reviewing these maternal deaths whenever the maternal and the perinatal death. Then perinatal death, regionally, we are at 3.7 out of 5. Still, a lot of efforts is needed, so there is an improvement. And I have districts that are doing far below the regional average, like Ginger City now. VHT reporting. About VHT reporting, we have improved. Out of the 5 score, regionally we have 4.7, meaning a lot of efforts have been put in place to ensure that reporting is done. And this is mostly because most of the districts here are now implementing ICCM. I want to thank PMI, the Malaria Reduction Project. They have really put a lot of efforts to see that we are reporting on the ICCM without forgetting the UHA. They really support this on a quarterly basis to ensure that these reports come through. Percentage of under 5 dewormed in the last 6 months. Out of the 5 score, regionally, we have achieved 4.1. 4.1. But we have some districts that are doing below the regional average, and these districts include Bugwed, doing below the regional average, Namutumba. So I think we are seeing that we are looking at where to put a lot of efforts as far as this financial that we are in is concerned. Then average of SPARS score. About SPARS, these are normally score done by the medicine management supervisors who normally move around during support supervision with a standard tool while scoring. The standard tool has sections. It has the quality of prescribing, stock management, stores management, ordering, and reporting. So these are scores that are entered into the system. And regionally, out of the 5 scores, we scored 3.9. We are still doing badly. So we need to pull up our socks and see that we improve. Now, I told you that we normally always have 16 indicators. And here we have looked at 15 indicators, leaving 1. The one indicator left is the local government performance assessment, which is normally done by the OPM's office. And the source of information, we did not have access to the source of the information. That's why it is not reflected here. So, going to the ranking, Jinja City takes the first position, followed by Iganga, Kamuli, Namayingo, and the worst performing district is Mayuge district. I want to thank the IPs and Ministry of Health. However, there are some challenges that we normally face during this reporting. And I can highlight them because without reports, we could not have this performance. One of the challenges is unstable electronic systems. Unstable electronic systems. We are therefore requesting Ministry of Health to see how to stabilize the reporting systems. They are on and off. A point in case, the MTWAC system. If you ask me now to log in the MTWAC system, I cannot log in. If you ask health facilities to send through the reports cannot come through. So we are appealing to Ministry of Health to see how to stabilize some of these systems. Another challenge is the reporting tools. This has very many issues. For instance, right now, the tools have been revised, but we have not started officially, we have not started using the new tools. But if I can tell you right now, some of the new tools have been supplied to our health facilities through NMS, and the system has not yet been customized. So you imagine the quality of data that will come through. People are using different reporting tools, and the system is reading something else. So this is something that Ministry of Health need to put into consideration. Then another one, we have many systems introduced in the district. A lot of demands from the biostatistician. And the biostatistician is one in the district. We are therefore requesting Ministry of Health to increase on the number of the biostatisticians in the district by introducing a senior position for the biostatisticians. We have served for instance, like me, I've served like 10 years, but I'm still a biostatistician in the district. We have the qualifications more than the position of a biostatistician. So we are really calling upon the Ministry of Health to look into this such that a senior position is introduced at the district level. Thank you very much for listening to me.
Thank you very much, Owekitibwa. I think clap for him more. Yes, the biostatistician who actually qualified to become principal biostatistician or greater, but because of the issues at the recruitment and the ceilings. Otherwise, that was great. He has shown you that how Busoga is. And I'm certain that during the National Health Assembly, I think Busoga will be ranked somewhere. There are about 17 regions as far as health is concerned, and Busoga must be somewhere. Because if we see some have got 80%, 82%, 73%, if it was academics, that would be A plus, and then some A's, and then B minus and C, except for the last district you could get perhaps C minus. But anyway, it has performed. 66.9% is no mean achievement. We really congratulate Mayoget District, Mukulu Ali, and all the biostatisticians. Thank you for what you are doing. The other things he has mentioned, those are not ours. We have known tools and the others, the data tools they use and so on, and the percentages and the coefficients well, but at least they help us to know where we are, and then we can begin from there, go back to our districts and find a way of improvement. After all, our theme today is improving health services in the Busoga region through multisectoral collaboration. How do they do it? I mean, Jinja City, okay, we've heard that they need to pull out regional referral hospital, and then when they pull it out, perhaps Jinja City will be fourth or something like that. Now, Iganga is second, doesn't have a regional referral hospital. Iganga is second. How does it do it? I mean, how did they do it to get, to get 73.7? There is no regional referral hospital. How does Dr. Kitimbo do it? I mean, Dr. Kitimbo is the DHO of Iganga. How do you do it? I mean, ADHO, Mukulu Karim Muluya Mwebaza is the assistant district health. How do you do it? There is the ADHO, the one in charge of maternal child health, that is Rose Baluka. How does Iganga do it? I think, let me invite the biostatistician of Iganga district to just give us, they were second. How do you do it? What are the best practices that you do to make sure that you are at that level? Let us have Mkulu Waibi Musa, the biostatistician, on behalf of the district health officers also present here in this room. You are welcome.
Thank you, presenter. Moderator, thank you. Good afternoon, ladies and gentlemen. Protocol observed. I'm called Waivi Musa, District Biostatistician for Iganga, and I'm here to present on behalf of my DHO, Dr. Chitimbo Patrick. Some guidance. That is slide number 1. it is talking about human resources in our district. And as you see, we are, as a district, we are standing at 82% staffing norm, and this is according to the old structure. And then according to the new structure, we are 26%. As you see, house much as we are having work pressure on our health workers, since we have Iganga as a general hospital, which is a mother district to 6 districts which are surrounding it, and our wage bill is limited. However, to manage the staff, which is not all that the ideal is supposed to be 100%, how have we managed to perform with the 82%? Our HR, using the HRI system, we have been able to track staff attendance, and the Human Resource Office has also helped us to sanction the culprits who are absenting themselves on duty. And through this, we have also an active rewards and sanctions committee. We do not only sanction, but we also reward best performing health workers. On the side of private facilities, to ensure them that they do report in DHIS2, some districts are lagging behind with private facilities, whereby we register them in the system and they end up not reporting. We have set a district supervisory, it's a district supervisory board or committee, which is trying to set rules that if you are not adhering to reporting, they don't license you in the next financial year. Next slide. Sorry. Next. Where? This is our OPD attendance, and this OPD stroke ANC attendance. This is how we are faring. As you see the trends, those are quarterly trends per each indicator, but I will only single out ANC first trimester. Much as we are below the national target of 42 and we are at 37, there has been an increasing trend, and we believe that in the next coming quarter we'll be there. This is our slide talking on maternal and PNC services. How have we done it? We have achieved the data you are seeing there. The trends are increasing and they are promising through community awareness. Through community awareness, here we are engaging radio talk shows, community dialogues, and the political leaders have helped us much to air out awareness in the communities to the functions where they go. Be it weddings or funerals, they are doing a good job and we would like to thank them. Secondly, health education has been strengthened right from ANC visits, whereby we are packaging messages to pregnant mothers telling them the importance of coming back for ANC, as well as delivering, the importance of delivering in our health facilities. Therefore, advising them not to go to TBAs. Next, VHTs have mapped out pregnant mothers in the communities, and they are helping us to do follow-up, whereby if some are resisting we go there as health workers to support the VHT in that we make these people come deliver in the facilities and bring their children for PNC attendance. Then follow-ups of mothers by VSTs, I've already put it. Next slide. This is creating awareness on PPH, as you are seeing. The health workforce in our district is committed to eliminate or reduce maternal deaths in the community. So this is part of the awareness campaign, and as you see, the ADHO maternal is there, well representing the district. Maternal and perinatal audits in the districts. That's how we are faring. Perinatal review, we are standing at 98%, but still the 2% has already been audited, only that we have not yet put it in the system. Then maternal review, we are standing at 100%, and credit goes to the midwives and the doctors in Iganga Hospital and the Bugono, who have made this a success. We have a committed team and a district. I've already talked about that. Then formation of groups to handle particular file audits. There has been a challenge to audit perinatal deaths. As you are aware, Iganga Hospital is a facility which has a big workload, and auditing perinatal deaths has been a challenge. But now what have we done? We have formed teams in that every week each team has work which has been assigned, and it is the responsibility of the team leader to ensure that perinatal deaths are audited on a timely manner. We have what we call effected weekly accountability meetings conducted. Through these meetings, we are ensuring that these teams have audited perinatal deaths timely. We have what we call support from the DHT members, which is extended to lower health facilities. And this is aided by our dear ADHO MCH. We want to thank you for the tireless work, because I always call you whenever I see in the system that maternal and perinatal deaths have not been audited, and you've been moving there personally to ensure that this is a success. This slide here is talking about perinatal teenage pregnancy. As you are aware, they have reflected here the teenage pregnancy rate for the region being at 23, and as Iganga, we are standing at 19%, and we've been there, and this has been a slight increment, but before we've been at 18%. Much as we have registered a slight increment, we are still below the national figure. How have we reduced teenage pregnancies? We are engaging school health education. Through targeted health education, we've been moving to schools using our senior health educator, and she is also an iron lady who has helped us improve. Here we're engaging senior women teachers in the schools, engaging the teenage girls, telling them the dangers of getting pregnant early, hence improving teenage pregnancy. Another thing, we have IPs who have formed adolescent groups, and these groups were formed with the purpose of curbing down HIV/AIDS among teenage pregnancies, and we have what we call Mukobat and Strong Minds. We are capitalizing on these groups. Whenever they are going in the field, they are engaging our health educator, the senior health educator, to go and take this message to the youths and adolescents in those groups. That's how as you are seeing here, nationally, as Iganga, we are given an award for reducing teenage pregnancy. And I'm glad to inform you that in the eastern region, we are the best. That's why you got that reward. You are seeing the PS handing over the gift to our DHO, Dr. Patrick Chitimbo. We have also increased immunization and disease surveillance in the district. As you see those indicators in the table, we are not doing badly. We've put the national target vis-a-vis our targets and the Busoga targets. How have we done this? VHTs do register all unimmunized children. After registering them, we are using what we call defaulter tracking tool to go and identify all defaulters, children who are not immunized. After finding them, you know, some have myths and they don't want their children to be immunized. These VHTs inform us, and we go there as a team to ensure that all the children who are unimmunized are immunized. We also do spot checks. Spot checks here, we have health facilities have work plans to go out in the community to do outreaches. So as DHT and health facility in charges, we do conduct spot checks to ensure that our health workers are really in the field doing the intended outreaches. And this has earned us a mark. And as you see, the fully immunized, we are at 83%, but the trend, the quarterly trends are showing that we are improving and we will be there at 90%. Then also we are using LCs. Not only LC1 chairman, we are involving the committee. The LC has various members on the committee, and we've used them. You might find that in some villages, LCs do command, but they have their shortfalls. If in a certain village the LC is not faring well, we do engage other members of the committee, not leaving behind VHTs, to mobilize these people and work on them. So we also have an improved cold chain system. We have a dedicated DCCT called Niger Fiona. She's very committed, a lady, but she can even climb the roof to fix solar panels. Recently, they brought fridges which are solar powered, and this lady is always climbing roofs to put these solar panels right. And as you see in the picture, she's repairing one of the fridge which was faulted in a health facility. Quality of care. What have we done? When you look in that table, we are seeing some indicators, and I will single out the stillbirth rate. We are seeing that the stillbirth rate, the trend is showing a declining trend. The maternity department has worked hard to see that they are saving newborn babies. We have a doctor called Roland who is in charge of the pediatric ward. This doctor works tirelessly. When we move to the maternal wing, we have a doctor called Dr. Pontian Chwanuka. These have been outstanding in causing all these changes in our facility, and we have to applaud them. The other thing, we have got solutions where health facilities are calling us as DHTs to go and attend their meetings, and we've always been going there minus asking for transport. As we attend their meetings, we devise solutions as a team. And our role as DHT is to monitor what we have agreed in the meetings to see that it is implemented. DHTs also follow up on health centers which are not faring well by finding able and skilled health workers to be placed in such facilities in order to improve their indicators. I will give an example of Bugono Health Center 4 and Busoga Health Center 3 in Nachigo Sub-County. These facilities in the last financial year were not faring well. But as a DHT we start, because we've been changing human resource here and there, but the facilities had failed to achieve. For the case of Bugono, we have two doctors called Dr. Noah Mundago and Dr. Yahaya have tremendously changed the image of Bugono Health Center 4, a facility which used to conduct only 2 cesarean sections, now it's conducting more than 20 cesarean sections in a month. And Dr. Mundago, thank you very much. Machaz is doing all that. Those two doctors are not substantive. They are acting, but the zeal they've shown, even if they call them at night, they fuel the vehicle and they go to operate women in that sub-county, and we are really grateful. Send my regards to Dr. Yahaya, Dr. Noah. Thank you. HIV/AIDS. Here we are having indicators as seen. What have we done and what have we not done? We have the 95-95, as you are seeing on the slides. We have managed to achieve 2 95s. The reason why we have not achieved the second 90, here we have issues like stigma. We have self-referrals out of the patients or clients, and then documentation. Documentation here, we can look at it in a way where people or counselors are delaying to update registers, and to some extent, they may fail to update a client. And this has caused us to perform at a 92%, but I assure you, coming next quarter, we are going to rectify this, and we're already in the facilities trying to put our documentation right. We will be performing. Much as we didn't meet our second 90, we also have good record management to follow up on the clients. We should not have shortfalls when we are doing work. These things happen, but we have to upload our medical records officers at the facilities. Then we have routine mentorship. And this support has come from UHA, MJAP, and other implementing partners, where these people are mentoring our counselors and health workers on how to handle HIV indicators. Thank you, UHA. Thank you, MJAP. Then we have the support to lower facilities by the lab focal person who has mentored our lab assistants and technicians. As you see that picture, she was in the prison, health center 2, and she had gone there to mentor the staff on how to improve on the testing, in that we get accurate results. Lastly, on that slide, Iganga Hospital was accredited to an international level, and this was due as a result of hard work from the district lab focal person, Madame Nantale Mariam, who has worked tirelessly to make the Iganga District Hospital shines. And this is an international accreditation whereby Iganga now can carry out tests which are not carried out in these other local health facilities. Malaria reduction, what have we done? We have mentored and coached health workers in each and every facility. Here we have to thank the Malaria Reduction Activity, MRA. I saw Mr. Chris. We are really grateful. We have distributed malaria channel boards to all health facilities. I and my HMI's focal person, we've been going around the district to mentor them on how to plot malaria on these graphs. And these graphs are supposed to be updated on a weekly basis. These graphs help them monitor malaria stock, as well as they can monitor stock on malaria, as well as monitor cases which are going beyond the normal. And this is an outbreak. So a facility is able to identify that we are in an outbreak, and then they do carry out solutions. How do they do this? They get follow back to their OPD registers and see which villages are sending malaria cases which are abnormal to their facilities. Once they find out such villages, targeted outreaches are sent to such villages. They health educate them, cut the bush, remove the stagnant waters, advise them to sleep under mosquito nets, and by so doing, we have reduced malaria. And as you see down, we have a malaria channel, which is in the range. The red line is the upper limit. Malaria cases are not supposed to go above the red line. That is the upper limit. Once it goes above, the green line is showing the malaria cases for 2024. Once that green line goes above the red line, it signifies that that is an outbreak. We have also conducted community dialogues, whereby we get views from the communities who are giving us information. Why are they not using mosquito nets, and they opt taking them to gardens and opt them taking them for fishing? They tell us their views. Once these are myths, we educate them that nets have no problem as as they are treated. Last on the slide, we have audio towers in the communities, and these are zindaros, whereby we air out information. Stock management, this is in regard to malaria. I'll not go. We have SPARS, a committed team, and the way they carry out their stock taking is wonderful, and that team you see there has done a great job doing redistribution where necessary. Challenges, as I told you, the hospital and lower health facilities are burdened. We told you that Iganga is a mother district to 6 districts which were carved out of Iganga, and all their workers are coming. They reside in Iganga, and it's where they go to seek care in case they fall sick. This has caused limited resources on finance, human resource, and infrastructure development. So we need a special budget. When the Minister of Health is allocating money to Iganga, they give it as a district, but rarely the population we are holding under health is for 7 districts. So as MOH, you need to revise that. Then staff accommodation is a challenge. We are standing at 40%, and this has caused delays of health workers to reach health facilities to offer the necessary services. I said it earlier that we have a small wage bill, which is small. Stockhouse of mosquito nets, and this is explained that mothers are not receiving nets as they are supposed to get. Thank you very much for listening.
Thank you very much, Mukulu Wambi Peter. Thank you very much, Iganga District, and they were second in this region. Thanks a lot, and you've given us the best practices. The best in Busoga region is Jinja City, of course. It has a regional referral hospital, but also remember it is under the careful hands of Dr. Stephen Vanonya. Dr. Stephen Vanonya is the rest of your health officers, thank you, district health officers. Dr. Stephen Vanonya is city health officer in charge of Jinja City. And he has been there, by the way, from municipality level. He oversaw the transformation and metamorphosis from Jinja City to include rural parts and then becoming Jinja City with Northern Division, which includes Bugembe, Mbudondo, and Mafubira, which areas also have health center force. And together with his team, which includes Sister Awori, thank you very much for what you are doing. We can have the biostatistician. I think, let's have Dr. Vanonya. Dr. Vanonya, please come over and, oh, he's already here. Thank you, Stephen.
Thank you so much, Mr. Chief Bangabo. Allow me to say oral protocol observed. I am Dr. Stephen Vanonya. I'm the State Health Officer of Jinja City, and I'm here to present on behalf of the Jinja City fraternity. But before I even do that, just to give a background, cities are newly created local governments that have been in existence for the last 3 or so years. Previously, we were operating, as you said, as a municipality, and we were under the auspices and the guidance of the district health office. But for the last 3 years, we have gradually transitioned into an independent body, and that's why I am here to present. It has been quite a journey since we started. Those of us who have been regularly attending our meetings, we were at the bottom of the league table. And, this one made us to work a little bit harder, because whatever indicators were being talked about, we would be ranked the last. But today, I am happy to be here to share with you the journey that we have been making and to see where we are now. One, we inherited a big chunk of the original Jinja district, but also we also inherited some of the health infrastructure and some of the health facilities. For instance, as a municipality, we only had 2 health center force, but because of our elevation to state status, we now inherited 2 other health center force, that is Bugembe and Budondo. This one has advantages and also has disadvantages, but to us, it has been quite advantageous. We were, at the time that we were elevated, we only had 2 health center force. That is Walukuba and Impomode, which health centers were not fully functional. Now, we also indicated 2 extra health center force, of which I think it was only Budondo that one could say was really functional at that stage. So we had to work around the clock and with the support of our partners to ensure that we functionalize our health center force. And to me, I think that was the turning point. I am happy to report that as we speak now, our 4 health center force are almost fully functional. We have been able to recruit doctors and anesthetists. It was it was not quite an easy thing, but with support of our town clerk, our service commission, our politicians and lobbying from politicians, in spite of the ban that was in existence, they allowed us to recruit doctors and anesthetic officers. And as I said, that has been the changer in the game. Can I go now to the presentation? Thank you so much. Yes? Slides A. Can I be assisted? Somebody assist me with slide. Oh, I was looking here, sorry. So in brief, Ginger City, that's our profile. It is serving a population of 298,000. It comprises of 2 administrative divisions, 26 parishes, and 141 villages. As I mentioned, we are served by 4 health centers, Impumo, Dondo, Warukuba, and Bogembe. And as mentioned by the previous speakers, the biostat from the one who represents the biostatisticians, Ginger Hospital, is still under Ginger City. So in terms of infrastructure, we are quite well served with facilities. Next slide. Next slide. Hey. Please assist me. Okay, thank you so much. Our success has been greatly contributed to by our partners. So those are some of the partners that we have been working with. We have PMI, Uganda Malaria Reduction Activity, that has been supporting us in malaria prevention and control activities. We have MJAP, which has been supporting us in the maternal, neonatal, child health, and the TB and HIV/AIDS. We have Uganda Health Activity that has been supporting us in the family health, health system strengthening, immunization, and reproductive health. We have the new kid on the block, Annabelle. This one has just recently joined us, and they are supporting us mainly in the maternal, neonatal, and child health. We have mothers to mothers that have been supporting us in reproductive health and malaria. We have WUDA that has been supporting us in TB and HIV/AIDS. And then Busoga Health Forum that has been supporting us in reproductive health. Next slide. In total, we have 56 facilities, of which 29 are private and 27 are public. Of course, the 27 include both the public facilities directly and also have the private not-for-profit. Staffing levels, as indicated, the overall staffing levels for the lower facilities currently stands at 29%, but for the health center 4s, we are standing at 32%, and the health center 3s, we are standing at 18%. The health center 2s, it is still that high because the structure for health center 2s was not updated. Maybe to go back to the last slide, as I mentioned earlier on, our changing and our whatever improvements we have had was because of ensuring that we have full functionality of the health center 4s. And as I mentioned earlier, at least for all the health center 4s we have at least 2 medical a senior medical officer and another medical officer. And we also have at least 1 anesthetic officer for the health center 4s. Next slide. Those are our pregnancy rates. As you can see, we we are not doing very well in the Northern Division. Northern Division is comprising of Bugembe, Mafubira, and Mudondo, so it is mainly rural. So the rates are quite high as compared to the South, which comprises of the Central Business Division of Central Division, Warukuba, Masese Division, Foma, and Mpomode Division, where the picture is slightly different, and I think this is because of the information. There's relatively better information to our children, our girls in the Southern Division as compared to information availability in the Northern Division. Next slide. EPI, that's where we are. We are not doing very well. I think this was mentioned earlier on. We are not doing very well in immunization. This was partly due to the digital reporting by SPT, but I'm happy to inform that, as you can see in the fourth quarter, we now transition from the fourth quarter, we now transition to the OD system, and the picture seems to be changing. We have also put in place several mechanisms, like for instance, we have given targets to our facilities, and we monitor these targets on a weekly basis. Two, we have also encouraged them to continue conducting daily immunization, especially at the health center tools, because there was a very big problem at the health center tools where they were doing immunization only once in a week. But now we are emphasizing that they do daily immunization. And three, we also emphasizing that we need to conduct regular outreaches, because this is also something that was not being done for one reason or another. So we hope that with these interventions, we should be able to perform even better. But as I mentioned earlier on, the most important thing is that we have given them targets, and we are monitoring, and we have split the targets into monthly targets and weekly targets, and we are monitoring them on a weekly basis. We know we normally are trying to get reports from them on how many immunizations they have reached in every week, and where there are issues, we encourage them, to continue to make improvements. Next slide. TB, I think that is something that we have done very well, and I think it's across the region, and really kudos goes to our implementing partners, especially MJAP. They have been there for this. Please, MJAP, we thank you so much for this, and we hope that we shall continue improving. We have a particular problem in Jinja City, where we have identified some spots, what we call hot spots. We have the area of Chikaramoja. Those of you who know Jinja very well, that area is in the Masese, and we have discovered that most of the cases are coming from there. And the Karamojongs is a mobile population. They move, from their place, come here, and during the daytime they are in the town scavenging. And we have been also informed that these people, even when they are put on treatment, because they are not getting other motivations, they don't take their medications, and instead prefer, because the MDR group of people, when they're on treatment, they are given some monies and some foods. So the Karamojongs, in their thinking, think that the best way for them, if they want to benefit from that, is not to adhere to treatment and evolve the other form of TB. So we are continuously engaging and educating them, and we have also put in place mechanisms to ensure that they adhere to treatment. And as I speak now, we are in the TB campaign, and one of the hotspots that we are really combing up is that particular place, Masese Parish and Warukuba West, because most of the cases are coming from there. But I want to appreciate our partners, especially MJAP, Mothers to Mothers, WUDA. There's also now a team that is now on the ground, that is Warim, that is helping us to address the problem of these hotspots. Now, the lesson is learned. Ladies and gentlemen, I want to share that to say that we are very lucky as a city, that we have a lot of good cooperation between the political and technical, to the extent that we conduct joint monitoring on a regular basis, at least every quarter, and we move out with our leaders, the mayors, the secretary for health, the town clerk, the human resource officer, and the other heads of departments. We move together, to see what is happening. And, I want really to appreciate again our partners who have been funding these activities on a regular basis. USAID, UHA, PMI, MRA, NABEL, LPHS, and the others, as highlighted earlier on. Two, on human resource management, we have had issues of late coming and absenteeism. And I think this is also a cross-cutting issue. And what we have done as a city one is to conduct spot checks. Spot checks that we go to a facility without their knowledge that we are going there. We just, decide that let's go and visit this facility. And this has helped us, to check on the staff absenteeism. Where we find that a staff is absent, we raise him or her to explain why he's not around. And because of this, putting them on this kind of pressure, we have noted that this is reducing absenteeism and late coming. And I want to appreciate my town clerk who is here, who has been the key person in this area. The town clerk, Mr. Choli, we want to thank you so much for supporting us in this area. We're also working with the office of the RDC. Once in a while, we move around with them and try to put people on pressure. And this has helped us in one way or another. We are also having regular performance review meetings. These ones start at the health facility level, and the day after, we have what we call the city performing review meetings. And this one has, helped us quite a lot in identifying the gaps in areas where we are not doing very well, and then, and then also, putting in place strategies to improve, but also sharing from the good performers from the other areas. We normally hold monthly CXT meetings. This is also some kind of performance review to discuss issues of performance and to come up with, with interventions to address where there are gaps. Very important. I want to appreciate once again, our collaboration with the implementing partners. I want to tell you that without these implementing partners, probably would not be where we are. I've always mentioned this whenever we have these meetings, that for the first time, Ginger State, we have serious partners. We have very, very serious partners that have been, working closely with us. We conduct, in the area of functionalizing, probably maybe just to highlight on this, to functionalize health center force, we had issues of equipment. For instance, one of the theaters we have in Mpomode had no theater equipment. I want to appreciate that Uganda Health Activity came in handy and provided the necessary equipment. As we speak now, we're also having a lot of infrastructure developments. One is the new maternity ward in Warukuba. You'll see the picture later on, which is also being undertaken by Uganda Health Activity. But in addition, NABEL has also come in, to put up a niche in the Warukuba, and also they're also planning to put up a niche in the Bugembe as we speak, as we speak now. They have also helped us in mentoring our medical officers in terms of skilling, because one of the reasons why probably we were not doing very well was that they had knowledge and skills gaps. So working with them and Ginger Regional Hospital, which I also want to recognize, we have been able to impart skills, surgical skills to our doctors, and they are now comfortable, conducting cesarean their section. So really, I want to really to appreciate these partners for this. The other one is the weekly performing monitoring, especially in EPA indicators, which I've already explained earlier on. And it is helping us to identify where we're not performing as quickly as possible. This picture is demonstrating the involvement of our technical supervisors, not technical, but administrative supervisors. The person that is standing there is our town clerk, Mr. Choli, and we were in one of the meetings. I think it was a performance review meeting, and you could see that he was participating actively and even doing some facilitation. Mr. Choli has been in this field, I think, for quite some time, and if he begins speaking, you may think he's a DHO, because he knows everything. So I want to appreciate him to the extent that, this has really helped us, because for success to be achieved, we need the involvement of the top leadership. So thank you very much, Mr. Choli. This one is the most wonderful one. For those of you who know the gentleman on the extreme right, that is our new commissioner, I think. That is our new commissioner, Dr. Mugahi, Richard. And we want to appreciate again the support and technical guidance from Ministry of Health. Dr. Mugahi was here for, I don't know, he has been in the Jinja City facilities, I don't know for how many times, just to ensure that whatever we agree on, we implement. Whenever you agree on certain activities to do, he conducts what we call follow-up visits. And this one has really motivated us to make improvements. So I want to thank the Minister of Health, Dr. Mugahi in particular, for the continuous support, supervision, and monitoring. One time we had some equipment that was missing. I think it was I don't quite remember, but he gave instructions just to make sure that the theater is fully functional, and we're able to get it there and then. So we want to thank you so much, Dr. Mugahi and other ministry officials. Next. Now this one is this one is again partners, and I think this is now UHA that was also conducting supervision to Mpomode. We had a lot of issues in Mpomode, but because of these engagements and checks and visits from several areas, Mpomode has now changed completely. Okay, it has changed completely. So we want to thank you, UHA. I think this is UHA. I can see my site is not very good, but I can see the director, regional director, and the doctor, I think Dr. Stephen, among the pictures. So, the support has been, on a continuous and regular basis. And where there are issues, you sit down and agree on what you should do, what we should do. Now, this is one of the on-spot visits. I think this was done in Mpomode again. Mpomode, because we have put a lot of emphasis on Mpomode. I'm on this side, and my assistant is the other side. And this one has really helped us, to keep our staff on their toes. Because, when you continue, when you come and you are not around, and then we come and you are around, then we then forward your name to the rewards and sanctionees committee. So this is one of the interventions that we have had, and as I mentioned, I think we are making some positive strides. This is a partner collaborative meeting. I think this was a meeting with several partners, and we are discussing our planning for a quarter. And this is the way we do our things. We have those meetings, and we come together and agree on how we are going to plan activities and in the city. So this one helps us, to take one direction, to minimize duplication and avoid wastage of resources. Now this is the infrastructure. For those of you who have been in Walukuba Health Center had the challenges. The maternity was on one side, and then the theater was on the opposite side, and between the two was a busy Tamaka road. So you could imagine if it is raining, okay, how do you transport a patient from across the road, to the theater and then back, okay? So it was quite, an inconvenience, and with support from, as I mentioned earlier on, UHA, we have this facility. I think it has now gone beyond that. I think it's now almost 90% finished, and it is a very beautiful building, and we hope that when it is completed, we will be able to provide our mothers with respectful maternal care. So once again, I want to thank partners. And when this was put up, NWL is now also coming in to make an extension with Enicho. While these projects are going on, we are very grateful, but now the issue is the human resource, because we know we are going to require more midwives and more doctors and more other staff. So what are some of the challenges? One is inadequate funding. Two is the inadequate human resource, according to the government structure, which I mentioned earlier on, is around 29%. The ban I've been hearing that has been lifted. I've actually read it even in the papers, that the ban, I've even read the communication that has been lifted. But interestingly, when our town clerk and the human resource went to public service, they were told that there is no money. Even for the recently upgraded Kisima. Kisima is an island facility. And it was constructed a very beautiful structure. It was equipped. What we did as a stopgap measure, we picked some staffs from other facilities and took them to start on the activities, with the hope that the government was going to allow us to recruit. But the information we are getting is that we were told there is no money for recruitment, even for that facility which has recently been upgraded. Our plea is that at least they should allow us to recruit staff for the upgraded facilities. The other challenge is the private facilities. Ginger, we have so many private private facilities. It is a good thing, yes, but the issues that we are grappling with, one is the quality of care, which is still not very good. And sometimes they refer cases, cases very late. Sometimes, they even managing cases like malaria, they are mismanaged, and so on and so forth. We are trying to see how we can build the capacities, but our challenge is, again, the high staff turnover. The reporting is erratic, as mentioned earlier on. The other challenge is ambulance. As I said, we don't have ambulance in place. We have had allocations on the paper, but we have not seen the ambulances. 2 allocations. One, I think, was 2 years back. We got even the allocation later. The ambulance was not seen. Recently, we got another allocation. I am told the ambulances are still somewhere being refurbished. So we are still waiting, but we genuinely need an ambulance as a city, in spite of the existing regional ambulance system. Solution is we want to request Minister of Health to increase PXC funding and continue support from the IPs. The other issue is recruitment. As I mentioned, we have new projects that are being undertaken, but these projects are going to be a white elephant in the grass if we don't recruit the required human resource. The other request is, of course, to provide an ambulance to the city. Lastly, I want to allow me to acknowledge the following. I want to acknowledge the Minister of Health for the continued support and guidance. I want to acknowledge our partners, Uganda Health Activity, please. Uganda Health Activity, can we give them a clap? I request. We want to acknowledge MJAP. Please give them a clap. We want to acknowledge Annabelle, new kid on the block. They have been around for a very short period of time, but they are doing quite a lot. I want to acknowledge Malaria Reduction Activity, PMI. We want to acknowledge Busoga Health Forum. I want to acknowledge Mothers to Mothers. We want to acknowledge support from WUDA. We want to acknowledge support from Uganda Protestant Medical Bureau. We want to acknowledge support from World Health Organization and UNICEF, especially in surveillance and immunization. We want to acknowledge IPAS. IPAS is also another partner that has been supporting us in post-abortion care. We want to acknowledge our other colleagues that work with TASO, AIC, Family Hope, CHAI. We want to acknowledge Jinja Regional Referral Hospital and G2G project. Finally, allow me to thank our Jinja State administration that have been so supportive. I want to support Jinja District Health. This was our parent, Jinja District Health Office, that we always consult from time to time, and sometimes share resources. So I want to thank them. I want to thank the city health team. I want to thank and acknowledge our health unit in charges. I want to thank our frontline health workers, especially the midwives. They have been so tiring. We want to thank our village health teams. If I have not mentioned your name, please forgive me. Thank you so much. God bless you. Thank you.
That is our very own Dr. Stephen Ibanonya, City Health Officer. Another round of applause for him. He is on the ground, He has told you how the people in the Chikaramoja would prefer not to adhere to drugs and therefore become, so that they upgrade to the multi-drug resistant, which he has said is going to tackle, and we are certain they will be educated so that they can take the drugs and we achieve the 95 index. So ladies and gentlemen, it has been great. This is great. Having listened to the best practices from those two, the best and the second, the runner-up, we can now discuss, what do we do? Where do we go? Do you have any other ideas? Perhaps not included, perhaps from yesterday. Are there other, where do we go next? We have got chief administrative officers, RDCs. We have got district health officers. We have got journalists who are also in health, like Busoga Health Press Association. May I invite one of the chief administrative officers, specifically the chief administrative officer from Kaliro district, Mukulu Gabla Simon, come chair this session for 20 minutes. We discuss and then have the closing ceremony so that we call it an assembly. Mukulu Gabla Simon from Kaliro. Thereafter, we shall have a closing ceremony week.
Thank you so much, Michael. Protocol, as already stated, ladies and gentlemen, I'm Simon Peter Gavula from Kaliro, privileged to be chairing this session of discussions. I want to believe we have enough. We have been writing, we have been noting, and we have enough of concerns that we need to share. But I want to invite the presenters that have been presenting, starting from the City Health Officer, Dr. Stephen, the biostatistician, Iganga, is it Namayingo? The biostatistician Namayingo, please come over. Biostatistician Iganga, you also come, and we handle this session very fast. Meanwhile, we are all going to have other discussions. They could be answering those ones, some of the concerns but we could also be having others that they may not be having answers to. But we are going in the session for discussions. Yeah. Are they coming? Yes. I want also to believe somebody is there to move the microphones. The session assistants, get prepared to pass over the microphones. The session assistants, I want you to pass over the microphones. Somebody is already up. We want to move on. Any help, please? We want you to pass over the microphones. And we proceed. As they pass on the microphones, I want to appreciate everybody. I want to thank you for the calmness, and I want to thank you for the attendance. Amid the weather we are in, the room is still full. Yes?
Yeah, thank you very much, Chair of the session, and all the presenters. Tasibula Peter Nkwanga is my name. I'm the district vice chairperson, Maiga district. In the performance from the district, we were the first from the bottom, but it's good we've shared the best practices from the best performers, and I think after here, we shall go and reorganize ourselves, and then next time we shall be the first from the top. My concern is that in the opening remarks of the minister, she talked about the lifting of the ban on recruitment, re-echoed by the gentleman Ginger. But then the biostatistician, I think from Namaingo, in the presentation of the performance and the indicators, the 16 indicator areas, that of the human resource. Most districts were performing well as per the old structure. But according to the new structure, all the districts of Busoga are performing below 34%. Whereas we appreciate the fact that we want to build health systems where we shall be manufacturing health at home. We need to empower and make the health facility repair centers fully functional in matters of human resource. So my concern and question is that we have the new structure, but as it stands now, the new structure is a sitting duck. I don't want to say lem duck because if you say lem, you'll be up in arms with an Odipo. It is a sitting duck. So what I want to know from the ministry and the members of parliament in attendance, because they do the appropriation, what plans do we have in the short term to have this new structure operationalized? Thank you.
Thank you so much. There are some two hands behind there. Pass over the microphone, please.
Thank you very much. I'm Matthias Mangen from Namaingo. I want in a special way to thank the leadership of the Regional Referral Hospital that as of now, the Regional Referral is felt in the Namaingo district. I don't know what's happening in the others, but at least Namaingo district is fully felt and want us to promote that engagement further. It was very clear from yesterday, some of the key officers from the Regional Referral were highlighting issues of lack of resources to reach out to support districts. But I want to mention this, that one, this is the direct representation of Minister of Health in this region. And many times we have seen Minister of Health coming to our districts without Regional Referral being a picture. How I pray that when the minister is designing interventions to come down to districts, they should be working through the Regional Referral, and we have this impact felt for continuity of support. And also, I want to note that ministers also appreciate that in most cases, when they have been deploying some staff to come and give us support in the local governments, sometimes they deploy staff to come and, they are coming with an objective of improving on our skill. But some of them come when they are not skilled enough to support us. I want to say that in local governments, we have equally very competent personnel that if you work through the regional referral, and if the regional referral maps out the skills that are available within the districts, you come and we have even some staff from some districts who can give support to ensure that for further engagement, there is continuity. How I pray that that is given attention. The other thing that I want to pray for is that we support from our partners. Let the regional forum be having engagements with these partners to ensure that their drive in our districts is having a blend of the regional forum. Work with them and work together. Many things are going to change. Thank you very much.
Thank you so much, Matthias from Namaingo. Yes?
Thank you. Still,
there is another hand.
I'm Abwire David, known as BD, District Councillor representing people with disabilities of Namaingo, Secretary, Health and Education of Namaingo District. Mine is just simple. It is like comparing PLOE results, Mukono and Namaingo District. You know, in history, Mukono District, during primary education, for them they are used of revising papers. In some districts, hard to reach, they see paper for the first time. This is a scenario whereby we are discussing the results of a city and a district like Namaingo, which has a health center for as the biggest hospital in the world. I was with the view that in ranking, at least we first group districts without a hospital which has only the health center for as their highest health unit. Then after that, we make the whole ranking in Busoga. To me, I wish Namaingo is the best. If it is number 4, and we have only Buyinja Health Center 4, managed with the Musao Karuba Charles, whom I'm seeing here. Thank you very much, DHO, Mukuru Mathias, for the teamwork, for God and my country. I remain BD Health.
Yeah. Thank you. There are some hands in the front here and in the middle.
Thank you so much, Chairperson. Maganda Godfrey from Kachira, those are my names. First of all, I want to take this opportunity thanking the staff of Iganga who are doing best, because when we compare Iganga to Jinja, who is number 1, we can take Iganga to be number 1. To that point, I just want to add on to a point said by the staff from Iganga of using the VHT. Sometimes we ignore these people on the ground, but surely they have the correct data from the villages. So to my thinking and my prayer is that if we can use these people, the VHTs on the ground, still we can gather the correct data from the ground. Secondly, it would be a question still to Iganga. He talked of motivating the good performance workers, health workers on the facilities. Please, you will just brief us how you are motivating those workers who are performing well. Thirdly, still, it will just be an advice that as Kachira, as estate, we are using these VHTs also at the ground levels. And I think as Cultural Health Center, we are doing well as collecting data, as visiting those people in the villages, and getting the correct information. So with those few remarks, allow me, Chair, to end it there, and may God bless us.
Thank you so much. Can you pass over the microphone to the front seats? We have overbread behind you there.
I'm here.
Yes, as you bring the others around here. Madam, continue.
Yes, I'm Dr. Sacheno Musbaho, the Ocean Health Coordinator of Ginger, which is under UCMB. As I alluded to yesterday, even today, I feel like when we are in Busoga Regional Health Assembly, the private not-for-profit outputs should also be clear so that we know out of what the public health is producing, what is the contribution of the PNFPs. Because a case in point, we have Kamuli Mission Hospital, we have Buluva Hospital, and many of the lower level health units, even Benedict here, sometimes produces outputs more than a health center for, because I have the statistics. But here it is like it is only public health facilities. So I would request that next time that we be recognized, because we also contribute a lot. Thank you.
Point noted, and you are highly appreciated.
Mandira David is my name. Secretary of Social Services, Bugweri District. I would like to appreciate this engagement, but I have 2 to 3 concerns. One, I want to how Ginger City acquired clearance to recruit, because Bugweri, since its establishment, we have been seeking clearance to recruit. Most of the critical position is strict. And more so, in the Bugweri district, we have only 2 doctors, and of which one of them has been assigned as the acting DHO. Now remaining with 1 doctor who can't perform to the expectations. I want to buy a leaf from Ginger City, how they secured this. Secondly, in Bugweri district, we have a center 4 that was just elevated, but initially it was a dispensary because it is where I was born in the late 60s. But when you look at the infrastructure, it is very worrying. It's a health center 4, it's the referral, the main referral of the district, but whereby when you go to the maternity wing, you find we have only 2 to 3 delivery beds compared to the population of the district. As we have 1 doctor in a district, we don't have an anesthetic officer. And it is very worrying and challenging to the doctors who are there when to come to the areas. They are so challenged. We don't have an anesthetic officer in the district. Lastly, I would like to request, because I have seen Ginger City, there are many implementing partners who are extending to Ginger District, I mean to Ginger City. My prayer is that they extend these services to rural areas other than engaging in the city. I don't know whether they have interest in the city other than the rural setting. Thank you.
Thank you. There was a hand in front. In front here.
Thank you. Thank you, the presenters. I'm Nakato Mary Annette, the woman member of Parliament representing the people of Buyende. I want to extend my sincere thanks to the ministry and to the government of Uganda. At least during my term, I have achieved some healthy centers. So far, so good, except the healthy centers that I've written to you, Engineer Otim and Dr. Sarah Biachika. Kindly take it up seriously. Now, I want also to thank the presenters. I'm on performance indicators. It is good I'm a health worker. Now we have left politics aside. I'm talking as a midwife, senior. Now when you look at the staffing of Buyende district, at least when they were showing the table, we scored somewhere, somehow. I'm not bothered about the position you gave us, but at least as a leader who has been in collaboration with my colleagues, we deserve a credit. Whoever accorded the performance indicating position, I think Dr. Isaviye Fred deserves an award because he scored in other indicators. Now, how did he score these performance indicators highly with a low staffing percentage of 22%? I want us to be neutral. We are not fighting for who wins who. But you know, in the administration, they say that salary may not be the only motivating factor to a worker, but at least an award. Since we as members of parliament are awarding ourselves, why don't we award some of our health workers who are really working? Dr. Isabidi, can you stand up and I clap for you? Members join me in and I request Dr. Sarah Biachika, we award him 22%. You get all those performance indicators. Whoever is concerned, please kindly take it up. We need to award Dr. Fred Isabidi for that performance. Thank you.
Thank you, Honorable. Yes.
Thank you, Chair and the panelists. I would like to thank the presenters. My name is Loy Katali from Jinja. I would be surprised if Jinja was one of the best performing districts, but we are the second last. I just want to inform everyone, I'm sitting with Dr. Biachika, that when the city was created, 2 of our health center falls joined the city. That's Bugembe and Budondo. Literally meaning Kagoma has no health center 4 and Butembe doesn't have. So our people are struggling, they are suffering, the ministry is aware. I'm only hoping that with time, they'll sort out that mess. Maybe that's why we are performing poorly. Iganga talked about their performance. I'm really impressed. I'm happy. Congratulations to you. I mean, you deserved the award that you received. Unfortunately, there is decentralization. And I don't know how often the ministry officials come to the districts to monitor, to review, to see how these people are performing. In schools, when this school performs well and another does not perform, they normally rotate. If only it could happen in the health sector, I think there would be a change. We have a general hospital, Buenge General Hospital. It serves some parts of Luoka and Kamli districts. I'm seated with Dr. Biachika also once again. This hospital doesn't have wards. It's understaffed. There is a time people had poison. There was a poison. People ate some food that was poison. We had over 100 people. We are grateful to the Busoga region that all the ambulances in Busoga came to Jinja to save these people because there were over 100. They had nowhere to stay. We had lots of admissions. Some were referred to the referral hospital, but people were staying outside on cannulas because we don't have wards. We are under decentralization. The money that we get goes to the districts, and I must say that what's done most times is renovations, 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 year in, year out. It seems like we don't have plans to expand. I think that should be looked at. These people are also understaffed. So thank you so much. I pray that the issues of ginger are taken into account. God bless you.
Yeah. Thank you so much. I want us to have more, maybe 2, 3 hands. They answer and we move forward. There's a hand at the extreme end. There's another one there, on my extreme right.
Yes, thank you. I'm Zija David. I'm the Secretary for Health and Education, Mayuge District Local Government. I have 3 concerns. One, as the Secretary for Health and Education, Mayuge District, I think this one goes to the organizer of the meeting. When you assemble the people for group photos, I don't know the Secretary for Health did not be remembered in this meeting. So next time, I humbly appeal that they are also very important people to be remembered in such big meetings. That is a concern. 2, I have my concern vis-a-vis the presentations which has been made. I think I expected, as we get the good relief for those good performing districts, I also expected to get some of the district representatives, the DHOs from those poor performing districts, like Mayuge, to also come up with the challenges, also the concerns, what could be leading such districts not to perform, not only going with only the good districts, because I think with that we are leaving behind some of the challenges, because when looking at the structure and the policy, we have some of the concerns from different districts. We have area hard to reach districts like Namayingo and that of Mayuge. When you look at the population vis-a-vis the resource allocation, is also a big challenge. I expected also to get one of the concerns so that we can really relate, but not clapping for only Ginger City, which is having just a simple a hospital, regional referral, and is equipped. And when the ministry is coming, put too much emphasis with the city, leaving apart those rural districts. So if this meeting is to yield something good, I think let us also interest much to focus on the challenges which are encountering in those rural districts. So I think that one would be also a good issue to compare while listening. Honorable Nakato, thank you for the submission. But there is a concern which has been raised still here by one of the doctor. When they call members of parliament for the good of Busoga, you normally first request for transport. So I think, honorable members of parliament, maybe these are some of the challenges why we are not yielding much. So interest yourself to interest for the good of your people. Thank you.
Yeah, thank you so much. There was a hand.
Thank you so much. This is Stella Bauer, the Secretary for Health and Social Services, Vujele District. My concern is small, but not all that too small. I want to appreciate whoever has presented, but I'm raising this, I think, on the right forum, where in the House we do have the honorable members of parliament, the commissioners. There is a small category of people in health who were not thought of, like the health information assistants. This is where my request is coming from. Since we do have our honorable members in the House, could you please push that these people also can at least be remembered and enhance on their salaries, because they do a lot of work. And whatever we accumulate here, it's just because of their effort. It's my request in the House. Thank you so much.
Yeah, thank you. I had wanted to end there with the concerns, but I've not heard from at least from the RCCs, RDC, yeah, they are part of this engagement. Okay. But I thought there was something much. They are waiting forests. Okay, let us wait. Over, please. Panelists, we can answer. Choose out your questions that I think we can start from there. There are quite a number of concerns we have been noting. Dr. Okay, you're the first. Not out.
Okay. Thank you very much. I think there were a few concerns that there were a few questions that were to us. One was contribution of PNFPs. We are going to take this up. And in the next assembly, we shall have the disaggregations by the PNFPs. So really, it is a very good concern that we can take it up. There was something about VHTs, so it was for Iganga, but as a person from Namaingo, I presented for the region. I want to thank Minister of Health. They gave us funds that we distributed to VHTs. And in this vein, I am expecting that we shall have real-time data from the VHTs. We have trained them. We are waiting to see what will happen. Then lastly, about health financing. I want to thank our implementing partners, especially the UHA. We realize the importance of this during the OPM's assessment, where they normally ask for bottlenecks, planning, depending on data. And so the UHA team has really supported this that has happened in the health at the district, and therefore cascading into the health facilities. Now you see that in the health facilities, there is value for money. People are planning according to the priorities. Thank you very much.
Thank you.
Thank you. One member asked about how we do appreciate hardworking health workers. Appreciating someone, first of all, is not only about money. There are very many ways of appreciating hard and outstanding health workers. As I was presenting, I talked of an active rewards and sanctions committee. This committee is headed by CAO and the ADHOMCH plus other members of the DHT, and they are doing this work well. On a monthly basis, they ask health facility in charges to forward names of the people they think they have who have excelled in executing their duties at the various facility departments. When these names are forwarded, that committee sits and evaluates, because the names don't come alone. They give reasons. Why have you presented this person as the best performing in the month which is said to be being worked on? So the committee sits, and after reviewing the reasons which have been forwarded, the committee decides that in this month, this department, we have chosen this person as the best performing. After doing that, they invite these people and give them certificates. They give them some small gifts to appreciate them for the work they are doing. It's not only that they have big chunks of money to give these people, but a mere thank you can revive someone's zeal to do the work because they are putting in effort. As I told you, we have health workers who are called in real time, and they go far deep in the villages, like Nawandara sub-county. It's about 50 kilometers from town, Iganga town. But a doctor is called upon at night to go and save a mother who is going to deliver. And that's why you see now in Chuguru North, we are no longer having referrals to Iganga Hospital. But I told you these people are not even substantive, but they are doing the work as foot soldiers, and they have saved lives of mothers in Chuguru North. So, as I told you, the wage is small. Let us work upon opening this. Thank you.
Dr. Stephen.
Thank you so much. One is, how did Ginger City manage to recruit in spite of the ban? I think it is a question of leadership, as I mentioned earlier on. Our town clerk took this matter up seriously, and he wrote to public service indicating the justification for the need to recruit. And the biggest justification is that the hospital was complaining that they were getting so many referrals from some of our health centers, and the reason was that these health center fours were not fully functional. So we did that and followed it up with other visits. The town clerk, not me, the town clerk followed it with several other visits, and because of the pressure and the follow-up, the constant visits and reminders, somehow the city was allowed to recruit for only doctors, as I mentioned, and anesthetic officers. But as I explained, it was because we had a very good justification for the need to recruit. Two, how did Ginger City how was it being able to get many IPs? I think this question will be answered by somebody from Ministry of Health. But what I know is that many of these partners do not come to the city directly. Okay? They go through the Ministry of Health. And then they are then channeled to the different local governments. But I also imagine that because the cities are newly created local government, I think they need a bit of affirmative action, because they are really new and they have so many, so many challenges and so many needs. So I think in the wisdom, and they also serving very huge populations and very vulnerable populations. So I think in the wisdom of the ministry, they thought that there was a need to support the cities through, channeling these independent partners to the different cities. And I don't think this is only to Ginger City. I think this is also being done in many in the other cities that have been created. But I also want to say that when the partners come, again the question of leadership matters quite a lot. The way the way you welcome them, the way you engage them. I have been told that there are places where partners go and they are chased away, okay? And there are many demands that are put on them. But as Ginger City, I think our leadership is very open to this, and whenever partners come, we welcome them openly and work with them very, very, very closely, right from the top leadership up to wherever they are going to work. So I'd like to encourage us that when we get partners, let's welcome them. Let's see what they are putting on the plate. Of course, we have discussions with them. Sometimes they may come with an idea, and we tell them that this is not our priority. Okay, that is acceptable. So we need to be hospitable to these people, and as a city, I think we have benefited quite a lot from the partners. And I want to thank the Ministry of Health, that has been sending us these partners. I think those were the only two questions for me.
Yeah. Thank you so much. Ladies and gentlemen, there are some of the questions that needed answers from Ministry of Health. May I invite Dr. Yai to guide us through how best we can have those questions answered. For example, issues of staffing, issues on recruitment, the partners, and some infrastructure development at the facility level. Thank you.
Okay. Thank you very much, Chair, and our dear panelists. Probably we may excuse you to go and sit. I just want to say that, yes, as Chair has said, there are questions that have been raised to Minister of Health since yesterday. And I'm glad the chief guest to inform you that in this assembly, we invited a number of departments from the Ministry of Health to be with us today. We have the Commissioner of Clinical Services. I don't know if he's in. Dr. Ronnie or anyone from Clinical Services. If you're there, you just stand and wave. Probably I'm not seeing a hand. We have Commissioner of Reproductive Health. Anyone from Reproductive and Child Health Department? Okay, I'm not seeing. We invited the Commissioner, Integrated Surveillance and Public Health Emergencies. That one I'm aware is not in, but Dr. Issa Makumbi has been here. We have the Commissioner SCAP. Is there anyone from SCAP department? Oh yes, thank you very much for coming. We have Commissioner Health Infrastructure Division, Engineer George Otim. He's very much around. Thank you so much for coming. Briefly, there were issues related to upgrading of health center 2s to 3s. About 70% of our health facilities in this region are health center 2s that provide a small package of services. So there was a question on that, what is being done on this front. There was a question on X-rays. X-rays not functional in all our general hospitals. There was a need of ambulances not provided for constituencies. So there are constituencies without ambulances, and I know there are things being done in that direction. There are questions related to PHC allocation. You even heard today the demands to increase PHC allocation. There are questions on the new structure, operationalizing the new staffing structure. There are issues to do with the ranking of districts, especially the concern about some districts without general hospitals and without regional referral hospital, but they are being compared with districts with general hospitals and regional referrals. I know planning department will speak to that. And then finally, there are concerns about a second regional referral hospital for Busoga region, given that our population is now over 4 million people. So Dr. Sarah and team, I think if you can respond to some of these issues, and then we'll be able to highlight the way forward and go to the closing ceremony. Thank you so much. Yes, so probably the concerned departments can be given mic and they just speak to some of these issues so that we save time, and then we'll go to the closing ceremony. Thank you, Chair.
Can you pass over the mics? Session assistants? Okay. Doctors preferred. Thank you, Doctor.
Thank you very much. I'll respond to most of the issues that have been raised, and if there are any pending, we can handle them as time goes by. First of all, I would like to appreciate that in most of the presentations I had today, yesterday I was not here, but at least today, unlike previously, I didn't hear much complaint about the primary health care grants. And even in the presentations, many did not talk about funds, money that you receive from government. I know that is an uncomfortable area, but I'm directly in charge of that. So when I hear no much complaint about PHC financing, I'm a bit comforted because I know that over the last 4 years, we've worked hard to increase the primary health care grant to our lower level health facilities, including the traditional PHC grant, but also the results-based financing, mainstreaming RBF into primary health care. I would have really loved, and maybe in the next JRM, to look at aspects, and with support from our partners and the referral hospitals, how are these funds being utilized? Because in most of our supervision activities, we are seeing gaps there. And this is the money that should be going down for health promotion and disease prevention, so that we don't overload our facilities with diseases. So that is an area that we are looking at and expect that, apart from asking for more and more health facilities, what are we doing to reduce the disease burden? Because it's like we are promoting disease in terms of asking for more facilities than preventing disease. We should be preventing disease. I know those who fall sick, we must treat, but let us also focus on prevention. And we have provided the resources. We need accountability for those resources that are there. Me, I know in most facilities when we go to ask, they say ask the in-charge. It is the in-charge and the sub-county chief who know where that money is. Some of that money now, when you go, you find most of the in-charges are not there. They have gone to upgrade. And they are upgrading using that money we have sent to those facilities. That I wanted to say because I'm directly in charge of those resources that come to the local governments. For operationalization of the new structure, Ministry of Public Service communicated very clearly in the budget call circular of last financial, I think of the current financial year, since the structure was approved, that local governments can go on and operationalize the structure within the available wage allocation. But we all know there has been no increase in wage. So we continue lobbying, advocating with the Ministry of Public Service, Ministry of Finance, to provide additional wage so that we can be able to fill this structure. So it's not alone Ministry of Health. We worked in collaboration with the local governments. Ministry of Public Service approved the structure. We are all still waiting for wage to be able to have this structure filled. So that is true, a challenge that we are also concerned, and we will have to work collaboratively with other stakeholders to ensure that the wage is provided. Sometimes the ministry sends staff who are not, who have inadequate capacity to supervise local governments. Yes, that has been a challenge also at the Ministry of Health. We also have similar challenges of inadequate staff. So sometimes you want to supervise, but you don't have enough staff to do that, and you use the available staff. But in order to address that, we came up with the regional supervisory structure. What you are seeing here, that the regional referral hospitals are now getting more involved in working with the local governments, is an initiative by Ministry of Health to decentralize, because we also now don't have the capacity. The population has grown, the local governments have grown, the service delivery areas have grown. So this regional structure is an effort by Ministry of Health to ensure that we make use of the technical staff at the regional referral hospitals, and also expansion of the community health department of the regional referral hospitals, so that we have the right technical staff to come and support the local governments. The league table, you said we need to separate the local governments based on the facilities that they have. Yes, this league table has been in place for decades. It's not a thing that started yesterday. And the indicators for the league table were carefully selected in that they are primary health care level indicators. Primary health care level indicators means that they are simple indicators that the basic facilities are supposed to provide those primary health care services. And the assumption is that all our facilities, be it a referral hospital, a general hospital, health center 4-3, has a catchment population for those primary health care indicators. So it is a leveled ground. We don't assess on deliveries in this league table that surgical interventions or high-level interventions for hospital level. They are basic indicators, knowing that each facility has a catchment population that we expect you to deliver, to have in respect to those indicators. We also assess hospitals on their own, based on certain indicators for hospital performance. Even health center foes, we also have a league table, or assess them based on those other indicators in those services that they are expected to provide by level of care. So in that respect, that's why we urge and are working closely with the referral hospitals to strengthen our primary health care services. You find most of the mothers who are coming to deliver, say in Jinja Hospital, are from Mafubira. But they have left Mafubira Health Center 3 there. They have passed Mpumude and come to where? To Jinja Hospital. So Jinja Hospital is performing. So if you want also Jinja, referral hospital. So what we are saying, we need to decongest. And these people go and access those services at those lower level facilities. We have the case in point here, Chimaka Health Center 3, whereby we have constructed a maternity, a modern one. I don't know whether the RCC, resident city commissioner is here, town clerk is here, Dr. Banonya is here. That is an ISOA facility. And we actually feel that why didn't we invest and take this facility to somewhere else? Because it's lying to waste for 4 years. It was among the first health centers where we constructed the new maternities. It has never functioned. Why? Because they have failed to do landscaping and stop the stormwater from entering the facility. Now that it has rained today, when you pass there, you'll find all the water from the road is in that facility. So we are not motivated sometimes to invest when we see that the investments we have put in place have gone to waste. Specifically, Jinja City, we feel really bad and something has to be done to operationalize, to open up Chimaka, that new facility. It is giving a bad image. Even me, when I go to talk, we gave you a facility. My colleagues come and say, you cannot even manage, you have left. So what do you need? I think you have enough. So let us also make sure the investments that have been put in place are taken care of. Where there are gaps, we know a number of our health center fours have infrastructure of dispensaries of long ago when they were upgraded health center fours. The infrastructure has never been worked on apart from putting a theater. in our National Development Plan 4, it is one of the priorities to ensure that we functionalize health center 4s in terms of upgrading the existing ones to community hospitals and then construction of new ones where they are not. But that will require significant investments, but it is one of our priorities, and we actually hear you that we need to make these health center 4s functional in terms of appropriate infrastructure. The issue of a second regional referral hospital is also in our plan. As Ministry of Health, we have discussed this several times, and I think Busoga region is the priority region in terms of of regional referral hospitals based on resource availability. It is something we are working on, and it is a priority. So be assured that when resources are available, we are really going to upgrade another hospital to a regional referral hospital. The issue of x-rays, it is very true. We have a number of old x-ray, and already plans are underway to replace them with with digital x-rays. So that is also a priority area that we are really working on. Thank you very much, moderator, for that.
For doctors, she goes back to sit. She has made quite a number of points that needed clapping, but you didn't. Can we clap until she sits? Yeah. Thank you so much, Dr. Sarah, for answering to our concerns. It was very interesting and very encouraging. Dr. Yai, any other person answering? Are we done? We are done. With the, yeah. Members, thank you so much. I want to appreciate you for the participation during this session. And I want to hand over to the MC, Mike, to tell us what next as we move the closing session. Thank you so much.
Wow, a round of applause for our chairperson, Nkolo Gabla Simon from the district of Kaliro. Thank you very much for what you have done, especially for chairing this discussion. Let's clap for him a second time. Really, he has done a good job. And we also thank all those who have been able to answer queries and also supplement discussions. Thank you very much. Of course, on the program, we needed to know, so what next? Did we just come, sit here, and that is all? Is there an action plan? Yeah, of course, the Secretariat is working on that, and we wish we would present it, but because of time, may I invite Dr. Alfred Yai, just give us just highlights, and then we do the closing ceremony.
Thank you, MC. The chief guest and all dignitaries present. We have a secretariat that has captured issues since yesterday, and at this point, they should be presenting to us the issues and the recommendations. However, there's a suggestion that actually we close here, we go for lunch at once so that the people have time to travel back. So if we go by that suggestion, and in the interest of time, I'm proposing that the secretariat will complete the work and we share in the different platforms. And therefore, I'm proposing that we go to the closing ceremony. Are we together on that? All right. So MC, I think let's go to the closing ceremony. Thank you.
Thank you very much, Dr. Alfred Yai. We've agreed, and I'm sure the information is there, and I know it will be shared. Madam Lilian Nakisozi Varunji is ready with it at her fingertips. So now, next, we are going to the closing ceremony of this Busoga Regional Health Assembly and launch of the Public Health Emergency Operations Center. It was launched this morning by the Minister of State for Health General Duties, Honorable Anifa Bangirana Kawoya. Don't forget, it has been a 2-day event. Yesterday we had presentations from the districts, by the way, from the districts, both the best performing and even the least performing. They presented their challenges and it was great. We also had other presentations, for instance, a mechanism that links both the primary sites and the secondary, the hub and spoke mechanism. We had that presentation. We had a presentation about human resources for health. We had a presentation on HIV and TB performance, presentation on malaria situation from MRA, malaria reduction activity. We also had from maternal, newborn and newborn health and child health. We had a presentation on status of drugs and medical supplies. Now, we are sorry, there are some presentations that were pending, like the One Health approach, which brings out the interdependence between human health and animal health because of now the prevalence of these diseases coming up, the zoonotic diseases. It was not presented, but we shall be sharing the information. Then also we didn't have the blood bank performance from Uganda Blood Transfusion Service. That one will also be shared. We also didn't have the equipment maintenance situation or performance. We are sure we shall have that one shared. Let's have the closing ceremony. It's good that we have all come here. We must apologize. I must apologize on behalf of the organization. Yes, true. We didn't have a photo shoot for the secretaries for health. These are the people who are on the ground in every district on health matters. But we are having another photo shoot. At the closing ceremony, we had a photo shoot for the opening ceremony. We are having another one at the closing ceremony. And of course, in that one, we shall have the cows. They will be there. Then we shall have the secretaries for health for all the districts. We shall have the medical superintendents. Yes, that it was organized that way. We shall have, that's of the general hospitals and those in charges of health center force. And then we shall also have the Jinja Regional Referral Hospital Director and the staff there. We shall have the photo shoot there. Ladies and gentlemen, may I take the honor to invite some people to come in front here for the closing ceremony, where we shall also have presentation of certificates. May I begin with the chairperson of the district health officers of Busoga region. I think that is Dr. Kiria from Bujiri. If you could come in front here to be part of the closing ceremony. Is he around, Wanange? He's not around, okay. One of the DHOs, Mukulu Mulu Yakarim, you can come over and you are part of the closing ceremony. Then I could also have the chairperson of the chairpersons of LC5. Chairperson of chairpersons of LC5, Mukulu Elijah Dikusoka Kagoda of Kaliro District, you are welcome. Then I also could have, could I have also the chairperson of cows, that is chief administrative officers and town clerks. And we have Mr. Choli. They've talked a lot about you. Dr. Wanonya was telling us you are very involved. You are actually involved in up to the ground. Mukulu Choli Guloba John, please come over to the closing ceremony. And then, yes, that one. Then we can have the chairperson of RDCs. Chairperson of RDCs, that is set up. Then the chairperson of RDCs and the RCCs, and that is Mukulu Richard Gulume Variaino, the RCC for Jinja City. You are welcome in front here. And let me also invite a member of parliament on behalf of the parliamentary caucus for Busoga, that is MP for Luka district, Honorable Esther Mbayo Mbulakubuza. You're welcome over here. Thank you. That is the Honorable Member of Parliament for Luuka. But we thank you, the MPs who have come. It's great that you are here and are still here. And then, of course, for the chief guest. For the chief guest. Good. Do I have anybody missing? Nobody's missing. Okay, we have the RDCs there, the MPs there, and then we have the LC5, and then Mr. Choli for the cow. I think, good, and DHO is there. We are going to give you a few minutes closing remarks in that order until finally we now have the chief guest coming to close and then give the certificates. I also want to thank the organizers for having thought of Kifo Bangabo Michael, having thought of me as the master of ceremony for this function. It is great that I'm interfacing with so many people in the health sector and many people from the polity and many people from other sectors. I want to thank you very much, and I pray that I am invited another time. Very important for me, especially as a student of advanced epidemiology. Thank you very much.
Thank you so much, MC. Protocol observed. Ladies and gentlemen, on behalf of the chairperson, district health officers, Busoga sub-region, I want to appreciate the organizers for this wonderful assembly, where we have discussed important issues concerning the health of Busoga population, and I want to appreciate whoever has been into the organization of this assembly, that as we participants, the DHOs, the ADHOs, the biostats, the politicians, the administrators, they have helped us to give us a yardstick on how we can improve service delivery in our districts as we leave this place. More so, looking at the best performers and the worst performers. But what I want to encourage those who were not mentioned as best performers, I want to inform you that everything is possible. For instance, Jinja stay or Iganga stay has not been the best most of the times, but they have managed to do a few things which have made them shine. And I believe, given an opportunity and time, I know you can make it. So I don't want to take much time. I was given only 2 minutes to give my remarks, but I want to thank you for coming, and I wish you Jan Masses back to your districts. Thank you so much.
Thank you. My name is again Elijah Kagoda, the district chairperson of Kaliro, and I'm grateful for having been given this opportunity to say something on behalf of my colleagues. First of all, today is a historical day because we are assembling here to share issues on how we can improve on health service delivery. taking note that Busoga has many issues. One of them is to be marked as the poorest region. No wonder these are some of the issues that cause us to have high levels of morbidity and mortality. But I'm grateful to the organizers of this workshop, or assembly, for carefully selecting participants who, in my opinion, are going to cascade down the issues that we have discovered that are critical for us to improve on health service delivery. I am also grateful that issues that have been shared on performance in the different health facilities and at different levels have been analyzed. I come from a district where we do not have a general hospital, but I realized, like one of Namaingo mentioned, that these districts, which are hard to reach and sometimes have no hospitals, coupled with the limited manpower, like Honorable Honorable Nakato put it, do struggle hard. And I want to hail them for the performance, and also pray that the Ministry of Health will take into consideration where resources are available to provide those necessary resources to enable the secretarial staff at those health levels to perform accordingly. Three, I would like to appreciate the local leaders, the LC5 chairpersons. The LC5 chairpersons are mobilizers together with the other DCs. We have realized that with local government, we cannot survive without a healthy population. Looking at the funding gaps, we entirely depend on local revenue, which must come from our population. So a population which is healthy will definitely work and be able to generate money where we expect local revenue to support service delivery, and especially in the area of health. I want to take this opportunity, as I'm about to conclude, to thank Dr. Yaye, the director for Jinja Referral Hospital, for the good work you are doing. Dr. Byachika, I want to appreciate your comment that as a ministry, you are trying to look at regional hospitals to provide supervision, the lower local, to the lower levels in the districts and the hospitals, including health center force. Dr. Yaye, I want to thank you because you have been on ground. You are not a talking doctor, but a practical person, and I would like to thank you for that. When you visited the Cariro, there has been a general improvement in the service delivery. Now people know that there's somebody supervising, including the DHOs and those staff. But in a special way, I would like to thank the minister who has come to launch the Busoga Sub-Region Emergency Operations Center, where I belong as a member, and I'm very sure this will facilitate to curb those emergencies, including the monkeypox. Without taking a lot of time, I would like to ask all of us to take back the messages, especially the district leaders, to share in our district councils and to impress upon the communities that there is a hope that issues of health will be tackled as a region. I would like to add my voice to the appeal made by one member who appealed the honorable members of parliament. First of all, to thank those who have always been around for Busoga issues. I want to mention, I'm not praising them, but I want to thank Honorable Nakato. You have always been around whenever there is an issue that touches the entire Busoga. But when you go back, please, in your parliamentary sittings as Busoga sub-region, appeal to your colleagues, at least if they cannot come, to send apologies to show that they are part of us. It is also a polite way of showing that you are aware, but you take note that you are needed. Mwebale kuiza, Katonda abaletere, abatuuke emirembe. Thank you for listening to me.
The chief guest, the honorable members of parliament, the RDCs, the chairperson 0C5, all technical staff in their various capacities, I want to take this opportunity to thank you all for this very important workshop and for the convener. For us as technical staff, when we begin talking as a region, I know we are moving. I want to thank the convener, Dr. Yai, as a person for his teamwork, because since he joined the regional hospital, we have engaged with him and he has put health on the ground. I want to thank him. I want to thank also the commissioner, Dr. Sarah Biakika. He has been on the ground, but there are some issues he raised which I want to mention. The Kimaka Health Center, the maternity ward. As a city, we have earmarked money for this financial year to make sure that we operationalize that one. So when you go back to the ministry, tell them that it is in our budget, it can be seen, so should not continue lobbying. Maybe before I leave that, I want also as a city, you know, as a city, as Jinja City, we are the first of the region. So we expect better services. And the regional hospital, much as it is within our vicinity, we are supposed to have a district hospital, and we have land. So I request that in the planning, we should consider Jinja City to have Udondo to be upgraded to a general hospital. Having said that, I want to thank the ministry for bringing able partners who have partnered with us and who have been very active in supporting health activities. But as a ministry, through this workshop, because I've attended fully from the beginning up down, if we are going to promote our health promotion, you are sending resources, but the health promoters, because we have recruited most of the nurses, we don't have the health educators. You find the sub-county can have one health educator on the ground. So most of the nurses we recruit, they are at the health facilities. And even the health educators whom we have, means of transport they don't have. So I want the ministry in their next budgeting, if we are going to promote health education at homesteads, let us consider that cadre who can move around in the parishes to make sure that they educate our people. And we have not also facilitated the VHTs at that level there, who I've been told that they are health center ones. They have not been facilitated. It is the implementing partners who have been facilitating them here and there. So as a ministry, we should have a comprehensive policy. How we move health education to the homesteads, as I have been educated. The Honorable Minister and the Minister of, and the commissioners here present, we want to thank you because the structures were approved. But as the chief administrative officers, for us we are the chief cook. The chief cooks in these structures here. But we have the structures, but we have not included staff. And the government has been saying from 2010 we are going to increase your wage. So when you approve a structure and you have not provided for money, so honorable members of parliament, I urge you that the structure has been approved. The Minister of Health did their part. So you need to urge the Ministry of Finance to look for resources so that we can be sure that the health staff can be recruited where they're supposed to do. Because when you're operating at 29%, at 38%, as a city we have been given infrastructure by the partners and even the government. But now with the 29% staff, you find that we shall do very little, and some of these projects are going to remain white elephants. So I want to urge government, look for resources, the structure were approved so that we can have health staff in these areas here. And the cadres for health promotion, let us find a way how they can be promoted because they don't have transport to move around to make sure that the health goes to the people. My father was a parish chief, but you could be able to move to these homes here those days. But now you have a health educator in the city here, where you have maybe a health educator moving in the whole of the division. It becomes quite difficult. So I want to thank our government for all the effort you have done. But if we are going to improve our health infrastructure, let us make sure that we look for resources, we recruit the staff, and the health promotion, let us find a package, you the professionals who are here, so that we can find how we can communicate with our bosses here, the chairperson of LC5, because the government has structures from chairman LC5 with up to LC1. And these are people who have microphones on barriers, on what. We should find a package, how we educate, how we transform our leaders to make sure that in whatever forum they are able to discuss health issues on those forums there. And also another area is of our faith-based and cultural leaders. We have left them, but they interact with the community. Some of their messages to the population, as far as health is concerned, like in the family planning and the other areas, some of them, their message has not been good. So as a professional seated in this place, let us find a way how we can engage faith leaders and cultural leaders and maybe create a package. How we can remodel them because they have the microphone at all times. And we have been educated that health is made at home. These are people who are discussing with the people in their homes, on funerals, on burials, how the message can be packaged, so that we can reduce the burden at our health centers. And the commissioner, I know Sally was also in haste for the health workers, but the attitude has not changed if you move around some of our people. For those who are here, they have changed the attitude, but when you move in these health facilities, the attitude has not changed. So as a ministry, find a way how you can counsel these health workers. Because for us, we are not well facilitated, you know very well, but we do our work. So the health workers and the ministry find a way how we can motivate our nurses who are on the ground so that it can change because of that bad attitude. That's why you see our mothers still continue to be attended to by the birth attendants, the attitude. And for the in-charges, introduce some management courses because most of them, they think that when you are clerking is the most important thing. But find how you can introduce some management courses for the in-charges to know how to manage. Because you can find like a doctor, we have had so many regional directors there. And yet the ministry is supposed to connect through the regional hospitals. But his methods of work has been different from other directors. So the in-charges of hospitals and health center force, as a ministry, find a package how you can also motivate them to manage these units. So with those few remarks, I want to thank the convener of this part, the Ministry of Health, and all the local leaders, our DHOs, and all the participants who have presented. There have been able presentation. We should not take who was first, who was last, because I have been moving in very many forums where the city has been bad indicators in red. But we have been encouraging ourselves and discussing with our staff, that's why we have moved. So when we come and talk like this as a region, we shall improve. Tomorrow, the other day, we shall be the best region in Uganda. I want to wish everybody journey masses home, but don't rush. Jinja City is a tourism city. Please enjoy around, because the other day is the weekend. Feel free when you're in Jinja City, for God and my country.
Thank you very much, Town Clerk. I'm called Richard Gulme Valiaino. I'm the regional whip of all RDCs in this sub-region, and I'm also the RCC of Jinja City. I want to take this opportunity to welcome you to the city and also thank the organizers for having chosen the city as a venue for this very important interaction. When we are talking about health, we are talking about everybody, because we are all here because we are alive. No dead person could walk in here. Even the sick people could not come in here. So when we are ranking, when we are looking at all activities, all ministries, health ministry should be given a priority, because it touches everybody at every corner. And when we are talking about the health workers, all those in that sector, we should be mindful that they are there because of a calling. Sometimes I visit that referral hospital to visit my friend, Dr. Yei. When you go at the emergency there, you find somebody who is coming, whom they have just brought, and you don't think that in the next 20 minutes be alive. The following day you find him walking because of our health workers. So as we talk of planning for the whole government, I think we need to put more emphasis on health factors. You know very well that government emphasized on immunizations, and when you look at the recent population census, it reflects that almost Uganda has the youngest population in the whole world. 51% of the population is 17 years below, which means we have managed to have the younger people produced and they are living. But also that one becomes a challenge that we need to plan better. For instance, we have our children ward here, Nalufenya. I want to invite most of you, the leaders, and especially the MPs, to visit that facility, and we start finding a way forward for such a facility. You find 4 children on one bed, 4 children on one bed, and the space itself is really a big challenge. The space where these health workers are operating from is a big challenge. Some are calling upon the Ministry of Health. Since we have already realized that the population, we have the biggest, more than a half of the population of the country are younger people. Let's also try to address the facilities, especially which are handling younger people, because it is a serious matter, and I'm sure it's not only here in Busoga or Jinja, but all over. I want to thank the organizers of this interaction. In many cases, as Busoga, when we had these fragmentations of districts and so on, people start thinking within their small districts and so on. Yet this was the original thinking. What we are doing here, this was the original thinking of Busoga. Busoga used to think as Busoga, to plan as Busoga. Because maybe for the younger people, but those who have been around for some time, we used to have one district at Busoga. So let's start thinking as Busoga so that we can be able to support each other. I'm very sure no district can say they can stand alone, but if we are together, we can have one voice and handle some of these challenges as one voice. For instance, this issue I brought of the facility of the children ward should be addressed as one voice so that we see how to handle it. A healthy community is a wealthy community. When people are healthy, they become productive, and of course they become wealthy. You know very well that whenever you have challenges of sickness in your homesteads, the expenditure exceeds what your income always. So let's emphasize on issues regarding the health of our people, especially by sensitizing our people. I've heard one of us, the chairman, talking about it, and others talking about it, the town clerk talking about it. Some of us who have opportunity to talk to the community, but also have opportunity. For these days, we have many radios. But I hear, in most cases, on radios, there's a lot of politics and so on. Why don't we use some of this space to educate our people, to interact? Dr. Yayi, of late, you've been sending me some people to use that government airtime we have. I want to encourage you that right now we have about 5 radios every week giving us airtime. And I want to encourage, especially health workers, that you should utilize this time to sensitize our people, to interact with our people. When you go to radio, you are talking to millions of people. In 1 hour, you are talking to millions of people. So let's see how we can utilize that time very well. I want to thank all of you, our members of parliament who are here, the RDCs who have come, the chairman LC5, the COW, and all those very important people, the technical officers who have graced this occasion. Let's be good ambassadors when we live here to see how we can interact with other people when we go back to make Busoga Regional Health Assembly a reality. If we just go back and keep quiet, then we shall have just come here to pass time. Yet, sincerely, this could have a very, very big impact in our region. And I want to encourage you that whenever you have time, please pass by these facilities, even at Health Center 3, Health Center 2, to see what is happening. I'm aware that absenteeism is still a big challenge. As monitors of government programs, we are still having those challenges, especially in the lower health facilities of some of our health workers absenting themselves. But I think this can be addressed if we come together as a team to make sure that things change on the ground. I wish you well. Feel free, the town clerk has already said it, since we are moving the weekend, I have a weekend in the city, because this is your sitting room. Jinja City is the sitting room of Busoga. Remain in your sitting room when you're enjoying yourselves. May God bless you and join masses.
Our guest of honor, the honorable colleagues, all invited guests. My name is Esther Mbayo. I represent the people of Luoka. I'm here to represent the chairperson of the Busoga Parliamentary Caucus, Honorable Idi Savirie, who is not with us, and he has delegated me to say a few remarks. He's on other assignments. I want to make a few clarifications that when Parliament received the invitation, it was limited to only 11 members of Parliament. That called for the chairperson of Parliamentary Caucus nominating only one person from each district. And the nomination now had to go to the women members of Parliament because they cut across. We've been joined by Honorable Agnes Taka from Bujiri. She came in late because she was receiving a delegation from East African Alliance on Food and Nutrition. I want to thank the ministry for organizing the Busoga Regional Health Assembly, a platform where all the health challenges of Busoga region are addressed. I want to thank the development partners who have given a hand in this. And amongst others, we have PEPFAR, USAID, PMI, Busoga Health Forum, Gender Transformative Action, Ginger Referral, Regional Referral Hospital, MJAP, Steel Force Limited, UPSMB, Enabel, URC, and the OBLAM. We want to thank you so much. I want to thank the participants from the various districts who have made it from far and wide to grace this occasion. I congratulate the best two performing districts, and I want to request that you share experiences with your other colleagues for better results next time. Guest of honor, before I conclude, I have some remarks. Busoga Regional Health Assembly is expected to be all-inclusive, implying that all districts should have made presentations. But when I perused through the program in yesterday's presentation, it is only 6 districts that presented. I mean, a presentation is meant for Hansard record capture, and this is supposed, all meant to form decisions that will form the budget for the next financial in as far as health is concerned. If there's any explanation on this, I'll be corrected. Some issues of Busoga region in terms of health have been ably elaborated by Professor Waiswa. Some of these challenges are very, very possible and can be afforded. We talk about, or we talk of, the regional referral hospital. Busoga as a region needs a befitting regional referral hospital in terms of structures. The structures we are having really is not befitting of Busoga region. And then we also need upgrade of the health center force to hospital status for the districts in Busoga that have not gotten, including Luuka district. I've lobbied my case, Dr. Biachika, and several times you've told me that Luuka is next on agenda. We've waited and waited and waited and waited. By this time round, I request that you capture it and then we continue lobbying our case. With those few remarks, I want to take this honor to invite the guest of honor, who is none other than Dr. Sarah Vyachika, to make her remarks and later close the workshop. I want to thank you, and I wish all of you journey mercies as you go back to your respective districts. Thank you.
Thank you all who have made closing remarks. I find myself in a difficult situation because according to the program, the guest of honor was supposed to be none other than the First Deputy Prime Minister and Minister of East African Affairs. So now as a technical person, I don't even know how I come in to take on that or put on such huge shoes to close on her behalf as guest of honor. Nevertheless, we have to progress and have this GRM concluded. So I humbly accept that responsibility and will speak and make a few closing remarks. I am aware that we are all really exhausted, been here for 2 days. We have pushed through lunchtime. It's coming to evening. But I would really, therefore, like to appreciate all of you for your commitment and being able to ensure that we meet the objective of this 2-day health assembly. Thank you very much for that. The theme for this assembly has been improving health services in Busoga region, but with focus on multisectoral collaboration. Usually a theme gives you a way forward. Going forward, after all that we have discussed, the achievements, the challenges, the way forward, the organizers of this assembly, I'm sure, felt that whatever we agree on as we go forward, we must use a multisectoral approach. So for the coming year, can we now widen our lenses, open our eyes wider, increase our networks and collaboration to bring in other sectors? In the introductions, recognition, I did not hear the education sector mentioned or represented in this forum. I did not hear the wash sector. I did not hear agriculture. I did not hear gender, labor, and social development. And you all know we are all falling under the same program, the Human Capital Development Program, under the NDP4. So my expectation is that as we go back, we now embrace that multisectoral approach and ensure that the issues that are hindering us from achieving our targets are well addressed in the next 1 year. We are going into the budgeting cycle or budgeting period for financial year 25-26, and I'm sure we are going to have regional meetings, and therefore as we go forward to identify priority areas, as we go forward to engage Ministry of Finance in the discussions that are going to take place in the coming few weeks during the budget conferences. I request all local governments to speak and articulate these challenges. We cannot expect improvement in health service delivery when the human resource is not there. We cannot expect improvement in health service delivery when the required infrastructure is not there. So let us ensure that they are further discussed during the National Joint Review Mission, where a number of you will obviously be invited to attend and participate. So with those few remarks, I would like to add my voice to the previous speakers who have been speaking and all those who have spoken from morning, to thank the organizers of this assembly led by the hospital director, Dr. Yayi. We are very grateful for that. We would like to thank the partners who have supported this. I will not mention them, but we really appreciate both the technical and financial support. I would like to thank the district leadership in your various capacities for having graced this function of the assembly and attended in person. All the technical staff, thank you for the presentations, thank you for the discussion. The time you put in is appreciated, and for delivering the services. And lastly, I would like to thank our honorable members of parliament for taking off your time, sitting through this, and we look forward to you standing up and articulating the issues, because you have heard them firsthand from the providers that we have challenges in health. So as you go to deliberate in parliament, please articulate these issues. As Ministry of Health, yes, we do that, but we know appropriation of resources is by parliament. So we ask that you speak also on our behalf to ensure that we work together towards improving health service delivery. So with those remarks, I would like, I don't know whether these certificates are for now or after, but once the guest of speaker declares the assembly closed, then they cannot, that means that everything is done. I stand to be guided on that before I pronounce the assembly closed. Okay. Okay. So I think there is another function of awarding certificates that can take place before I pronounce the assembly closed. Thank you.
Thank you very much, guest of honor. Thanks indeed. Yes, we shall be giving out certificates in 4 categories, including certificates to the organizers of this healthy assembly, certificates to the institutions that have supported, and then certificates to the best performing districts. But we also have some certificates for individuals who have performed greatly in supporting the health sector. So those are the 4 categories. Ensure that you have registered at the desk. Please, that is an announcement. Ensure that you have registered. If you haven't, you could also check on them. Then another announcement, since it is for information, gathering, data collection, and so on, make use of Busoga Health Press Group. Those are journalists, and they are in the health sector to make sure they disseminate information. So from the districts, they are behind there. Busoga Health Press Group are available for you to disseminate all information so that our people can benefit from whatever you are informing them about. There will be also signing of the signature whiteboard there. I know the chief guest will sign, and all of us will have the opportunity to sign on that whiteboard. And then I told you about the group photo that will take place this time with the chief guest at the closing ceremony. And now, giving out of the gifts, they will be given out by the chief guest, but also by the director, and also by Honorable Esther Ambayo. Honorable Esther Ambayo can come over in front, and the following categories of people can come back. I think, let me begin with the organizers of the Healthy Assembly. Somebody with gifts organize, and those will be given out by Honorable Esther Ambayo. So organizers of the Healthy Assembly, Member of Parliament, Honorable Esther Ambayo, is giving out. The following, Dr. Yai Alfred, for chairing the Resource Mobilization Committee of the Regional Assembly. Dr. Afizi Chibuka, for commitment and support of Busoga Regional Healthy Assembly. Dr. Mulowoza Michael, for being the Secretary of the Busoga Regional Health Assembly. Mr. Samakula David, for chairing the Press Publicity and Protocol Committee. That is the principal healthy hospital administrator. Dr. Feristi Nahataba, for supporting the Busoga Regional Health Assembly. Ivan Kabugama, this is Ivan Kabugama, on the Finance Committee, chairing the Finance Committee of this. Dr. Patrick Musime, commitment and support. Dr. Patrick Musime. Dr. Nathan Ruhinda, for chairing. Dr. Nathan Ruhinda. Thank you very much. And then Mr. Milton Mwisaka for commitment and support. Taking it on his behalf. Madam Rosemary Angom. Dr. Peter Mikago. Rosemary Angom. Susan Alelo. Goreti Olupotakol. Karubabazi Keimbabazi Goreti, for commitment and support to the Busoga Regional Health Assembly. Natkunda Susan, for commitment and support. Susan Natkunda. Simon Atria. Margaret Katusime. Simon Atria, Margaret Katusime. Ankunda Diana. Ankunda Diana, Atubo Moses. Ofubo Moses. Dr. Richard Zimbe. Dr. Richard Zimbe. Mr. Kakoza Moses for chairing the technical committee. Mr. Kakoza Moses for chairing the technical committee. He's not around. Thank you very much, Honorable Esther Mbayo, for giving out these certificates to individuals that have supported the Busoga Regional Health Assembly. May I now invite Dr. Alfred Yai, the Director of Jinja Regional Referral Hospital, to give out certificates to the organizations, institutions that have supported the Busoga Regional. One, to use USAID Uganda Health Activity. Please come for commitment and support to the Busoga Regional Health Assembly. Then USAID Local Service Delivery Activity. Then Local Service Delivery Activity. Then AMREF Heroes for Health. AMREF Heroes for Health, come and receive your certificate. There's also USAID Local Partner Health Services. USAID Local Partner Health Services also come over for this. PMI MRA. USAID Local Partner Health Services, EC. Then PMI MRA. United States President's Malaria Initiative. Malaria reduction activity. PMI MRA. Enable, that's the Belgian Development Agency. Enable. Busoga Health Forum be coming over. Busoga Health Forum. Thank you very much, Dr. Alfred Yai, for giving out those certificates to institutions. Now, we are going to the best performing districts, and we begin with district number 3, and that is Kamuli District. Please come over and receive your award. The guest of honor is handing over to them. Dr. Sarah Biachika, you're welcome. District team, Kamuli, come over and receive your plaque. And then Iganga District for being second, number 2. Iganga District team, come for the award. I've seen the LC5 chairman, Kulu Ezra Gabla, and the team. Iganga was number 2. And then the best in the Busoga region, Jinja City. So Jinja team, come for your award. That is the RDC. Dr. Vanonya, Sister Warren. And then Uncle John Gulova Choli. The whole team of Ginger City is there. And then, Madam Guest of Honor, there are individual awards to people who have supported health in this region. Outstanding political leader, Mukulu Richard Gulume Baliaino, come and receive an award. Mukulu Richard Gulume Baliaino. Outstanding political leader, as far as health is concerned, he's always there. And then outstanding impact, immeasurable impact on local maternity and neonatal system. This present to Dr. Agure Bameka. Tombuwenge. Dr. Agure Bameka, come and receive your for immeasurable. If we were to put it quantitatively, it is infinity. And last but not least, an outstanding district health officer for unwavering support and unrelenting guidance that helped in leading Ginger to success. You are honored with much appreciation and gratitude, and that is Dr. Peter Diogo. Somebody come and receive on his behalf. Somebody come and receive on behalf of Dr. Peter Diogo. I'll have the town clerk, Nkolo, the cow. Okay. The cow of Ginger is receiving. Thank you very much. Thereafter, we shall have the photos. After the guest of honor has officially closed the function, we shall have the photo shoot of the cows, the secretaries for health, the medical superintendents and the in-charges for health center force, and the Ginger Regional Hospital director and the staff. Thank you very much. Madam Guest of Honor, you're welcome to complete your closing remarks.
Yes, thank you very much. So we are now at the tail end of the function, and I would now just say we would like to thank you all once again, wish you journey mercies, and therefore I officially declare the second Busoga Health Assembly closed. Thank you very much.
After she has signed on the board, we can have the secretaries for health from all the districts come over for the photo shoot. Then the cows, the chief administrative officers and the town clerks, and then city clerk, and then the medical superintendents of the general hospitals, and also the in-charges of health center force. Photo shoot here, and then the staff of capital of Ginger Regional Referral Hospital. Thank you. In that order. So the organizer for photos. We are waiting for the secretaries for health here. Madam Secretary, who raised the issue? We want you here. Yes. Dr. Yai, please come over for the photo shoot with the secretaries for health. Madam Guest of Honor, Dr. Biachika, the secretaries for health want a photo shoot. The cows also please be coming over. Those are the secretaries for health from various districts, and Dr. Yai is somewhere in between there. Madam Estambayo, please come over and join. These are the secretaries for health from your districts. Photographers, are you ready? Photographers, we are having a photo shoot here. When it is over, you tell me. Okay. Next are the chief administrative officers and town clerks.